I'm not that person anymore. And I don't know that I ever can be exactly that state of physical health that I was, but it's doing the things I can to optimize my health now and heal the issues that I am still. I'm not that person anymore, and I don't know that I ever can be exactly that state of physical health that I was.
Welcome to What I Wish I Knew, a Cancer Starter Kit podcast, where I share everything I wish I had known after getting diagnosed. In this episode, my functional medicine doctor, Dr. Dan, sits down with naturopathic doctor and cancer survivor, Dr. Maggie, to discuss how she navigated cancer while being immersed in the whole medical space. She hits on so many things about the need for second opinions and advocating for yourself. For me, there's 3 things I wish I knew about listening to myself. Number 1, it's easy to psych yourself out of believing nothing is wrong and you just need to suck it up or something. But it's most likely your intuition trying to tell you something. So if you believe something is wrong, it's worth investigating because your body, that's how it communicates with you. Number 2, listening to your inner voice is absolutely paramount. It may not be as loud as the other ones coded in shoulds or lack or comparison or coming from other people, but it really can be your guide of knowing your own limits. It might be like cancel more plans or ask for help or eat this, not that. And it can be scary, but sometimes everything you want is on the other side of fear. Number 3, a slow life is just as valuable as a go one, and it's most likely going to help you actually become more present throughout it, and you'll be able to detect what's going on within you. Here's Dr. Dan and Maggie speaking more about how to move through this.
Welcome to the Healing Cancer Project podcast. I'm Dr. Dan Sullivan, and I'm here with Dr. Maggie Boomgaarden. So welcome, Maggie.
Thank you. I'm so excited to be here. Thank you so much for having me.
Definitely. So a bit of an intro about Maggie. So Maggie has earned her BS from the University of Wisconsin-Madison and Doctorate in Naturopathic Medicine from Bastyr University with a clinical focus on integrative and functional approaches to cardiometabolic health, hormone optimization, gastrointestinal health, and longevity. Her training integrates traditional healing systems with advanced diagnostics and clinical science, allowing her to deliver personalized care that is both compassionate and data-driven. She's completed advanced training in cardiometabolic medicine, hormone management, lipidology, and functional lab interpretation, and pursued continuing education through the Institute for Functional Medicine, the National Lipid Association, and the American Academy of Anti-Aging Medicine. So her areas of clinical expertise include hormone-related conditions, metabolic health, gastrointestinal health, nutrition counseling, and sports performance optimization. And as a lifelong athlete, former personal trainer, and coach, she brings a deep understanding of human performance, recovery, and resilience to her medical practice. So she is currently a naturopathic resident at the University of California at Irvine, the only naturopathic medicine residency in a conventional medicine setting. And Maggie and her husband, Travis, have recently launched their own small private practice. All right. So in addition to that, Maggie is also a cancer survivor. So I think this is going to be a very incredible podcast. We're going to be diving into her personal story with her cancer diagnosis and then getting into her medical school training and then now becoming a doctor and practicing medicine. So a very unique outlook on cancer. So I think it's going to be really valuable for our listeners. So again, thank you so much for taking the time to be here on this podcast. So I think let's just start at the top and kind of give people a bit of a background on, what was life like pre-diagnosis, where were you at in your life, and then getting into, your whole journey.
Yeah, thank you so much for that introduction. It's been a very long journey, so I'm excited to talk about it and share about it. And really the goal is, hopefully that it can be helpful to, people listening who maybe have gone through something similar or know someone in their family or friends who've gone through something similar as well. Because as we, both know, being in medicine, but also outside of that, people are aware of how prevalent, unfortunately, cancer is. So, yeah, so your question about what was going on at the time. So my diagnosis was about 7 years ago. Thankfully, I'm healthy and in remission now. But at that time, it's really interesting for me to look back on it because that was actually before I started naturopathic medical school. So at the time, I was teaching high school. So a little bit more of my backstory. Before that, I, in my undergrad, as you saw, like studied science. My plan was always to become a doctor. I always wanted to go into medicine, even since I was a little kid. But when I was graduating from my undergrad, I really had a hard time figuring out where my place would be in medicine. I remember I was shadowing a lot of doctors. I was getting experience in hospital and clinic settings and doing all the things we need to do to prep for med school. And I really felt that I wasn't aligned with a lot of things in our conventional medical system. So I knew that I wanted to do things differently. And for me, that really looked like, spending more time with our patients, really getting to know them on a personal level and working with a variety of aspects of their health. So not just, we've all heard kind of the pill for every ill model. I really kind of felt like the more I got into seeing medicine, it was, okay, how can I quickly diagnose and how can I quickly give a prescription? And I didn't feel very aligned with that, but I wasn't sure how I could possibly do it differently because that's how our system, in the US is kind of set up. So I sidestepped away from medicine. I remember my advisor in college at the time kind of counseled me on, you have your whole life ahead of you. You can figure out your place in medicine. You don't need to make the decision right now. And I had a lot of experience teaching. So I'd always TA'd, I'd been a tutor. I, in the summers in college, went and taught at a program on the East Coast for high school students that was held at Yale for students who wanted to go to Yale, basically. And so she was like, you've done all this teaching. Why don't you just go into teaching for a while and you'll figure it out? So I'm like, okay, that sounds great. And I went abroad and was teaching English in Spain. And then when I came back from that, I continued in teaching still the whole time, kind of trying to figure out, always feeling this call towards medicine still. And so it was in my last year that I was teaching in the States. I taught high school for about 5 years. And I remember someone I met, because of course I talked about this to anyone who would listen, how my ultimate goal was to, do medicine differently somehow. And at the time I was living in the Midwest where it's not as prevalent as it is out here in California and other places. And they said, I met this person, they're a naturopathic doctor. And I feel like that's kind of what you want to do from everything you've talked about. And so they connected me to her. She was so great. I remember being so excited to speak to her. And she connected me with a lot of people in her network. And ultimately, I decided after those conversations, okay, I'm going to quit my job. I'm going to go to naturopathic medical school. I'm going to become a naturopathic doctor. And it was pretty quick that I made that decision once I found out what this was. And this was kind of around the time that I was probably sick but didn't know it yet. So it was in my last year of teaching high school where I started to notice I was getting sick all the time. I was feeling really tired more than I normally did. And I did start going to the doctor because for me personally, I never really got sick. So it was kind of out of the ordinary. I was, in and out of urgent care and going to my primary care and just always getting sick. So that was kind of like my first sign, I think. But of course, at the time, no one would, link that to cancer,
Right.
and I didn't obviously either. And I remember also just feeling so tired. And when I would go to the doctor or go to urgent care, they would give me antibiotics or they would, tell me, well, you're a high school teacher. You're probably really stressed. No wonder you're so tired. You have so many things going on, which wasn't untrue. I was also coaching sports and I was a student advisor and I was involved in clubs and many things were going on at the time. So I was very busy and stress was, high. I worked, that teaching job in particular was at a boarding school, a college prep boarding school. So the intensity of the workload was pretty high. And I think for most teachers it is, but it was kind of maybe like that to another level. And so I remember, just feeling very tired. I would sleep through my alarms and that was never normal for me. So I knew something was off. But I kind of just kept, pushing through it. My doctors would just say, it's stress, it's your workload, it's, you're just getting sick a lot because you're around kids all the time, and kids get sick a lot, right? Which is true. Like at high school, everybody, there's always stuff going around.
Sure.
So that was kind of my first sign. And then, I transitioned into starting naturopathic medical school. Like I put my notice in and I started my first year of school, which you can probably remember, medical school, the first year, it's intense. There's a lot going on. Yeah. And so, stress was very high. Workload was very high, probably even more so than my teaching load. And the school that I started at was the Naturopathic Medical School in Chicago. And at the time, the rate for students to drop out and fail out was very high. So there was a lot of pressure to do well and to succeed and to kind of survive those first 2 years to, stay in the program and be able to graduate and get your doctorate. So that's when I started to notice like some additional signs. So I remember being in school and still having kind of that really more severe fatigue as well as getting sick a lot. But also I started to have night sweats, which, we as doctors, we know this now. Night sweats can be a sign of cancer, but there's also, I always tell people this as well. There's many other things that can cause night sweats. So you don't want to panic people by, oh my gosh, if you're having night sweats, but it is one of the kind of key signs when we're assessing for cancer in our patients we ask about. But me being a new, medical student, I didn't know that. I hadn't taken pathology yet or diagnostics. You don't get into a lot of that until your third year. So I remember that started happening, and I did also seek, medical care for that because for me it was happening, a few times a week, sometimes every day. Then it wouldn't happen for a few weeks. So it was really on and off. But I remember I would wake up drenched in sweat, like absolutely just soaked. And I would have to get up out of bed and change my clothes, which again, not normal for me. I'm usually like run cold. And so I'm like, this is odd. Like, what's going on? So I remember telling my mom, and my mom's a nurse, and she does labor and delivery and postpartum care and NICU. So not in cancer, but so it didn't trigger any alarm bells for her either. She thought, maybe you're just really stressed, maybe it's anxiety, maybe it's your hormones. Like as women, sometimes what's going on in our cycle can cause hot flashes and things like that. So she's like, go to the doctor. And I remember I went to the doctor. And, I say this and I don't blame our medical system for anything, but I remember this visit. The doctor, thought, they said, well, do you think that maybe you're just wetting the bed?
Wow.
And I'm like, I don't think so. Cause like my whole body's wet. Like it's not like just, here. And I remember her saying, well, do you drink a lot of water? And I'm like, well, yeah, I do drink a lot of water. And she's like, I think it could be that. And so she wanted to prescribe me like a bladder control medication. And, I remember again, like after the visit, I call my mom, and mom and I are close, and I'm telling her what happened. And she's like, that doesn't seem right to me. And I'm like, it doesn't seem right to me either. Like, why would I be wetting the bed? Like, I've never had bladder issues. Like, is this a normal thing? Like, I don't know. And, and she's like, I don't think you should take that. So I didn't take it, but that was kind of another sign that started when I was in school. And then, from there, things kind of ramped up. So I would say, like, for me, the time I started having symptoms till, ultimately we'll get to the diagnosis part, it was about 1.5 years, maybe even like 2 years, but it was a longer period of time. And when things kind of ramped up, it got a little bit more serious. So I, after that, I remember noticing I started to have like pain in my rib area on my left side. And I also started to have chest pain. And I know you mentioned in the intro, I'd always been an athlete. I'd always worked out a ton. And so in addition to the more extreme fatigue that I had, all of a sudden I was having like exercise intolerance. I couldn't really run very far. I was having like pain. And it felt kind of like stabbing pain when I would breathe. And, I was like, this is not normal for me. Like, why, why
What's going through your mind at that point? Kind of having some of these symptoms, want like the fatigue, the nights were just things kind of stacking up.
Yeah, I feel like I remember thinking, I know something's wrong with me. To be honest, like cancer didn't cross my mind because I was in my 20s and I was healthy and I'd never had illness in my life. Really, thankfully, I've been blessed in that way. So it didn't cross my mind, but I thought, something's off. I knew something was off. And I felt a little bit annoyed with myself that I had gone to the doctor so many times. One of those other visits, another thing I didn't mention was, the doctor kind of mentioned to me, like, do you think this is like a mental health related thing? Like, are you having maybe just health anxiety? Are you, you know, um, maybe just anxious and that you're worried, because I was concerned that something was wrong, something felt off because for me it was so different from my norm. And at that time, of course, again, they wanted to prescribe me like antidepressants, anti-anxiety medication, which I'm like, you question everything. I'm like, am I just anxious? Or am I overanalyzing my own health? Like, is everything fine? And it's in my head, So I think I did know that something was wrong. I just didn't know what it was.
So you were just seeing conventional doctors at this point in the journey.
At this point, yes. I actually didn't start seeing naturopathic doctors and also chiropractors until I was diagnosed, closer to my diagnosis.
And then was there any type of laboratory evaluation or any kind of testing to try to, tease out, is this in fact a mental health type situation? Is this health anxiety or is this actually something physically wrong?
That's a great question. So up until that point, no. But once I started having some of the more severe symptoms, then yes. So when I started having the pain, like in my ribs and in my chest, and kind of the exercise, intolerance piece, I did go. That was the first time that I went to like our clinic that had naturopathic doctors and things like that. And initially, they wanted to do like rock tape and physical medicine and, so they did that kind of thing, which of course didn't like resolve my symptoms. But I went back for my follow-up, and at my follow-up, this is where, things kind of ramped up again because I had noticed that my arm started swelling, my left arm. And that was very strange. It's like, why is my left arm like all of a sudden very, swollen? And when I went for that follow-up, I remember saying, I feel like I need to have like imaging done. And of course, like in our profession, we don't like jump to that or do that first. But for me, I had been, um, experiencing symptoms for so long. I was like, I just want like imaging done of where I'm feeling this discomfort. I feel like there's something going on. And so the doctor there, it was a naturopathic doctor, was just like, okay, like they at that clinic we had like an X-ray because they also had a radiologist and chiropractors and things like that, which in Illinois they can do that in their scope. So like, okay, yeah, let's just do a chest X-ray. They're like, maybe you have like a pneumonia or something causing that, right? Even though I didn't present as if I had pneumonia. When the results of that came in, the doctor was actually one of my professors too. And so I remember, he pulled me in and was like, there's something on this. Like, you need to be seen by someone, like, pretty urgently. And of course, that kind of started the alarm bells, like, well, what is it? What do you see? What's going on? And of course, like, we know from an X-ray, it can't really tell you. But for me at that point in time, the mass that I had from the cancer was so large, it did show up on the X-ray. It was causing like shadow over my heart and my lungs, so they could see that there was a mass there. So I'm really thankful for, I believe in like divine timing of things, that I was there, because that doctor knew exactly where to send me. He was like, here's what you're gonna do. I know this imaging facility, they'll get you in today. You need to get a CT scan because we need to know what's going on. And I'm going to do this because ultimately, if I refer you to someone, it's going to take a while for you to get in. and then you'll have to see them, and then they'll have to order the imaging, and then if they order the imaging, that could take a while. So he knew like a low-cost imaging facility that he had a friend at, and he's like, I'll get you in today, and I'm like, okay, like, and of course I was very nervous and very anxious. And at the time, you mentioned my husband, Travis, we were engaged, so we were not yet married. So I remember calling him and just telling him, he knew I had all these things going on, symptom wise. And I'm like, they finally did imaging today and they saw something and he wants me to go get a CAT scan like right now. So he came and picked me up and he took me to go do that. And, he gives me this nickname, which is, he calls me his cute little bulldozer, because when I went to get the CAT scan done, they didn't tell me the results. So, in medicine, often when a radiologist reads results, he'll put the information on the results and it'll get sent to your doctor who ordered it. But they don't really go over the results with the patient. That's not the radiologist's job. But being in the situation I was in after the scan was done, I found him and I said, I want to know what's going on.
Yeah.
And he's like, well, I can't really. And, he's just there. This poor man, radiologist, like his job is just to do the imaging, and so there's all these other people needing their imaging. And I'm like, I'm not leaving until you tell me what was going on this, because I was very nervous and I knew that they found something. And so I just wanted to, I think at the time, have some assurance that I was okay. But ultimately, he's like, okay, if you want to wait, I can talk to you at this time. He was very reluctant. I hope this wasn't illegal. I don't know. But he had me come into his office and he basically said, from the report, I know there's a large tumor in your chest. I don't know what it is. You're going to have to get a biopsy. And again, I kind of pressed him. I'm like, well, what do you think it is? You're a radiologist. Like, in your experience, what could it be? And, we kind of went back and forth for a while. And ultimately, he did tell me what he thought it might have been, which was like, I think 3 different things that were cancer, 1 that wasn't. And so, I remember Travis and I were just not in the best mental place receiving that news.
Yeah. Was he there with you at the time?
He was there with me.
Okay.
And Travis personally. So my husband is the most optimistic person who's probably ever lived. So, we get this news. I'm crying because I'm assuming the worst. And he's like, it's going to be fine, babe. It's going to be okay. Like, it's going to be okay. I just know it's going to be okay. And we had no idea what was going on. We had no idea any details of, the potential diagnosis, but he was just like, it's going to be fine, and now he says he just had this like sense of knowing that it was going to be okay. I did not have that sense of knowing. I was crying and very panicked. Because I think even though I knew something was wrong throughout this whole time, in my head, I thought like, oh, maybe it's like, I don't know, some like autoimmune disease or infection or like just something minor.
What was that like, getting the imaging done and then actually, for somebody who was very active, an athlete, very healthy all of your life, to then, not only had these symptoms that were kind of leading up to this crescendo, but then to have the imaging and then you discover, wow, there's actually a mass in my chest. I can't imagine what the emotions that that you must have been feeling at that time, what that must have been like. And then for him to be the rock, during that point, I'm so glad you had him at that time.
I'm very, very fortunate that I had him with me. Yeah. I definitely was shocked. And, I think that one thing that I've learned from this experience is, when you're a health conscious person and you think you're doing all the right things, you kind of have a little bit of a sense of invincibility that, the bad things happen to people who maybe aren't taking the best care of their health. But But I think, what I've learned is you can still do all the right things, quote unquote, or feel like you are, or that you're trying to. And there's so much that we can control. And I think it's important to, work on those areas. But there's aspects of our health that, just like life, that are out of our control, that I don't like admitting that. And I don't like thinking about that. Um, but I feel that now I kind of know that I can do all the things, and I still can't guarantee my health will always be perfect. And I think, also as an athlete, as a young person, you do feel like all those things happen, when you're older. It just doesn't really cross your mind. So it definitely shocked me and kind of broke some of my my views that I had about control over my own health, for sure.
Yeah. I can definitely relate to that invincibility and, this feeling in naturopathic medicine and functional medicine. We're just doing everything we can to stack the odds in our favor. We're eating, well-balanced diet. We're trying to manage our stress levels. We're trying to, just, take proper supplementation and get our labs done, and making sure that, as much as we possibly can control, we are controlling and trying to optimize health. But there is that, and I think I want to get into that a little bit later in terms of, what can we control, what can't we control. But yeah, I think that must have shifted things for you a lot, having that, or getting that diagnosis, and then just having those beliefs sort of, or maybe those unconscious beliefs, that of invincibility sort of shattered.
Yeah.
So you got the imaging done at this point, and you don't know what it is, what happened at that point, or the next things that took place.
Yeah, so at that point, the doctor who had ordered the imaging did tell us, like, call me when you're done. And so I filled him in on what, we found out. And he basically said, okay, again, hopefully this doesn't cross too many legal lines, because, I do feel it's unfortunate the way our system is set up. But he was concerned when he, I had the report, I had them print the report, and I read the details of it to him, with the size of the mass, the symptoms that I'd been having, and for how long I'd been having them. At this point, like, we don't know how severe is my diagnosis, what is my diagnosis. So his main concern to me was like, you need to get this worked up and diagnosed as quickly as possible in case it's urgent and life-threatening, especially since, I had been having cardiovascular and respiratory symptoms. And so whenever that's kind of happening, we get concerned about, people's heart and lung breathing or function. So he, told me, here's what you need to do. You need to go to the emergency room. You need to tell them you're having chest pain, which I was, so it wasn't dishonest. But, he's like, in our system, when you do that, they have to do a certain workup. And when you bring that imaging in, they're going to have to work it up. He's like, if I, refer you to see like a hematologist oncologist, it's going to take months for you to get in.
Wow.
And for them to then see you in person, then order whatever biopsy or additional imaging, it's going to take a while. And he's like, I just don't know like how much time we really have to play with.
Wow.
So of course, like that, for me, made me a lot more anxious, because I'm also thinking, like, I was very concerned when I saw the results, and, the radiologist told me that, but I'm thinking, okay, well, there's still a chance it's like, okay. And like, and then hearing his urgency and the fact that like, no, I need to go do this right now. I started to feel more panicked, for sure. And of course, my husband, he's, fiance at the time, he's like, okay, we're going to go to the emergency room. We're just going to do what he says. And like, it's going to be okay. And I'm like getting angry at him at this point because he's not seeming worried. Yeah. Now I look back and I'm grateful that we both weren't freaking out, but he took me to the emergency room, and I ended up being in the hospital for about a week at that point. And it was a turning point because, we didn't realize how quickly it would worsen at that point, but my pain became a lot more severe in my ribs and lung area. And what was actually happening was that the cancer had grown over some of my like venous return areas around my heart, as well as the lymphatic areas that drain a lot of the fluid. So there was fluid building up around my lung on the left side, and my lung had actually, our lungs are fairly large when we breathe, and mine had really shrunk down to like a little ball because of all the fluid that was in there.
Wow.
So that's why I was having the pain. And so when I was hospitalized, they had to like drain the fluid, because if you have long-standing fluid around your lung, it can lead to long-term lung damage. So it can also eventually lead to like arrhythmias and like issues with your heart because of the way it was impacting my heart as well. So I ended up getting admitted to the hospital, and then that kind of triggered the workup for, a lot of blood work as well as biopsies and things like that. So it took a few days until they came back and, officially gave me the diagnosis. And I remember we, called my family, we called, my husband's family, and I remember there was a lot of people in the hospital with us, which was really nice, but my whole family was very like emotional and, concerned. So it was not the best of times. Yeah.
What was the diagnosis? And then what was that conversation like? And then tell us about a little bit more about the prognosis and kind of the next steps at that point.
Yeah. So I remember it did take a few days. So we were, kind of in the hospital, just not really knowing what was going on. I mean, we obviously knew like it was something, but I think I was still holding out hope that it wasn't cancer. There is like, I'm sure you're familiar, a type of teratoma, which is like horrible to think about, because if you know what a teratoma is, it's kind of disturbing. It's like human tissue. It's a tumor of human tissue that has like teeth and nails and hair and all these weird things. But I was hoping for that, because that's not cancer, and sometimes they present in the same area and the same size. So I didn't mention that, when they went over the radiology report with me, the size of the mass, it was like 12 by 18 by, 14 centimeters or something. So it was quite large. The doctor, his words to me were, it's basically like you have a big potato in your chest. So, that was a little bit like intimidating to think about. But when they did the official, testing and biopsies, it came back that it was a certain specific type of Hodgkin's lymphoma, which is common in, 20 and 30-year-olds. In terms of cancer, that's kind of the ages they see it most commonly. It has a bimodal distribution, so sometimes there's older life where it presents, but usually it's in younger people. And, they also do with cancer, of course, like nowadays even more, because this was 7 years ago, but a lot of subtyping in terms of determining how responsive it's going to be to different therapies and looking at the genetics of it and all these different things. So
They did some of that, you're saying, back then?
they did. They do even more of it now. But at the time, again, I wasn't like in the cancer world or familiar with this. So I remember when they came back to tell me, once they kind of had all the information, the doctor that came in just kind of sat down, and he probably said all of it in, 10 seconds, maybe 20, but he basically was like, okay, like, do you want your family in here or not? We have the information, like, and so I had them all come in because I knew they all wanted to know. They were all, just as anxious as me probably. And he said, you have stage 3, maybe stage 2. There was some discrepancy, which I'll go into there. Hodgkin's lymphoma. It is a more aggressive type that may not respond as well to treatment.
That may not respond to treatment, that's what he said?
May not respond as well
As well as to treatment.
as some other types do, based on the typing they did.
Okay. Wow.
And he said, there's a good chance you may not be able to have children. And of course, my fiance's sitting right there. And he's like, you'll need to do your treatment. You need to start it as soon as possible based on the size of your tumor and how long you've had symptoms. You've had this a while. You need to start treatment as soon as possible. we recommend you do fertility preservation if you want to have kids in the future. And I don't blame him. I'm not upset at him. We work in medicine now, and the way I deliver bad news to patients is very different. And I don't think that he's wrong or bad, but I think being an oncologist in a hospital setting where he's mostly doing diagnoses, he sees cancer every day. He sees cancer every stage. He sees probably people die, suffer,
Right.
and he's in the system where you're on a time crunch. You are paid and incentivized for how quickly you see patients and all of those factors. So I don't blame him. I'm not, I don't hold anything against him, but I did feel the way it was said to me has, I don't want to say traumatized me, but I get emotional when I think about it because I think it was just not delivered in a way with any compassion or sensitivity or emotion, empathy to the way that has, changed my life and for a while really ruined my life. And so that was really hard. And, I know we learn in school, like, the way to deliver bad news to patients when you have to give hard diagnoses. And we're often taught not to say we're sorry, but I usually do because I'm like, I'm so sorry that you have to experience this, that this is your situation, and I feel empathy for that. And I personally, I may get some like criticism for this, but I think it's okay to say that, to show humanity and empathy and emotion for life-altering diagnosis,
I think a lot of people can resonate with that. A lot of the listeners, if they've had a diagnosis, I'm sure can relate to that, where there was a lack of empathy, where, a provider just, I don't know whether it's, you would call that, being jaded or just the constant exposure, you just get desensitized to that. And, like you were saying, it's simply the system that we're in the conventional setting, unfortunately, is this insurance-based model where there is very limited time available to educate patients to have that empathy when practitioners are feeling that time crunch, just got to move on to the next patient. And then you're stuck with the ramifications of that, which is, an understandably traumatic experience. I can, there's definitely some understanding for that, but yeah, it's just such a life changing moment that, I'm sure you wish would have been delivered differently.
Yeah, and I don't feel like I even was in a place, even though he said, any questions, the way it was delivered, I felt like I didn't have any time to process what was going on,
I'm sure you were just in shock at that point.
to know like what questions to ask. And then he had to go. So, my whole family kind of started breaking down because, yeah, there were a lot of questions. And I think we just, we did, get them answered and ask them later. But I think at that moment, there was just like so many unknowns still. And, I believe he did also tell me like how many cycles I was going to need to do and what my treatment was going to be like. And, so that was kind of our introduction too, to like, that was a provider that, I could have done my care with. He did also go through like, you'll have to do like this amount of treatment and whatever. I don't think he went into all the details of it, but I remember at that point also just being very grateful for some of my friends who were in medicine, because a good friend of mine at the time, who was actually an oncology nurse, she was like, I think you need to reach out to some other doctors. I can connect you to an oncologist I know, but like look in your network, get some other opinions, because she's like, this is going to be a long journey and you want to get someone on your team that you feel comfortable with. And again, for me at the time, that didn't cross my mind at all. Like, and I think for most people, when you're diagnosed and you're in the system, even patients I see now, they don't realize that they have the option to seek, other opinions or on the diagnosis and treatment, which, I'm so grateful I did. We can get into that a little bit, but, or that there's, other doctors, because if you're going to be working with someone on your health, especially for something really serious, you want to feel comfortable with that person and well supported. And so, yeah, I think at that time, what happened next was they set up my surgery because I had to have a port put in for chemotherapy. So my treatment entailed, it was supposed to be a certain number of cycles. So I had to do, I think, 6 cycles of ABVD, which is a combination of 4 drugs, different chemotherapy drugs. And then at the time when he, diagnosed me, he said I would also have to do radiation for a while after the chemo. And so I think that, they told me they would call me to schedule that and then I would get started. But of course, there were still a lot of unknowns with like the fertility preservation piece and
Right.
all that at the time as well.
Yeah, so maybe let's get into that process. So at this point, you're still in the hospital, getting the diagnosis and having that roadmap laid out in front of you. Um, and then, yeah, I think let's maybe talk about. I think that's a really important point that you mentioned. Just upon getting a diagnosis like that, just go into understandably a state of shock and just don't realize that they have other options, to get a second opinion or to seek out another provider that they might feel more comfortable with. So then maybe walk through that or, any advice for somebody that might be in a similar situation right now or a family member in that situation right now, what they can do. And then, how can they best maybe even process things emotionally to then be able to make a decision, because I know just getting to a little bit of neurology, since I'm a brain health geek, when that fear response activates, the part of our brain, the amygdala, which is our fear center, activates, and that oftentimes will shut down our frontal lobe or our ability of even making executive decisions. So maybe walk people through just that process, or how they can think through that, those questions, and then kind of walk us through you finding your other provider that you felt more comfortable with, and then on from there.
Yeah, so I remember that eventually I was discharged. So I had the like fluid thoracentesis was done, a few times because the fluid kept filling up in my lungs. So they wanted to make sure that that was stable before I left. So I think that's why I was there for a little while, even after the diagnosis. And then I remember asking my friend, thankfully I knew her, how do I like get other opinions, or like, what does that look like? So she told me to kind of like request all my records. And I remember I filled out like a release of information. So I got a copy of everything because she's like, keep a copy of everything, ask for the disc or ask for the whatever, all the forms, and then, fill out a release of information. And you can do that while you're there so they can send your stuff wherever, you tell them that you want it to be sent. So she worked at a practice that was about like, I think an hour away from where I live, maybe 45 minutes. So I sent all my stuff to her area. And then she told me also that, what patients can do is if you're in a certain hospital or in a certain system, there's multiple like oncologists that will work there. So if you do, know someone who knows someone, of course you can, ask them how to send the information there. They may or may not be in your insurance or in your network. So that's a whole nother, piece of the puzzle. If not, then that makes it even more complicated. But within your own, insurance network, wherever you go, there's multiple oncologists that are there. So I also requested that I meet with 2 other oncologists in my network in that same hospital where I was diagnosed, and that all my information, was in the system already so they could all view it. But I wanted to hear like their take on the diagnosis as well as the treatment. So I remember I met with 2 other oncologists there, and then I also met with the one that my friend worked with that she really recommended, and like that was a little bit further away. And I'm so glad that I did that because the 2 that I met with, in addition to the one that I had, been diagnosed by in the hospital, they all kind of had a similar approach and view. And not that there was anything wrong with that, but I did tell them all, I'm a naturopathic medical student. I'm really interested in doing like natural things to support my health along the way. How do you feel about that? To be honest, like they were not amenable to that really. They advised against that. And
Why was that? Or what were their reasons for recommending against that?
I think because, with cancer, for a lot of oncologists, and I think this is changing now for sure, but I do think with cancer, there's a high risk. There's a concern for them that something's going to interfere with treatment. And there's also, a lot of it that just really hasn't been studied well enough for them to know exactly what's going to happen. And so I think for their own liability, as well as for, legally them to say, oh, it's okay for you to do this and that, it kind of puts them on the line. And I think a lot of them are very driven by evidence-based medicine, and not that there isn't evidence for, adjunctive supportive care. There really is a lot for a variety of things, which I'm sure we'll get into later. But if that's not really their area or their interest, just as is similar for us, we kind of stay up to date on the things that we see a lot, we're interested in, or we're passionate about, we want to learn about. And so I think a lot of them also just don't really know and are concerned. So that was one thing that kind of swayed me away from that. And the other one that I met, who my oncologist I worked with, who I absolutely adored, was like, oh, you're going to be a naturopathic doctor? Can you bring in the stuff that you're learning about and show it to me so I can like use it with my patients? He was so excited. And, the other difference was all of them were recommending that I do the chemo as well as the radiation. And this other one, he had a little bit more expertise in blood cancer specifically. And he was the only one who said to me, you know what, there's new research that's come out in the last year that has shown that for, your type of cancer specifically, that doing this full chest radiation, because of where the disease had spread in my lymph nodes, I would have had to have it from my neck all the way to like my pelvis almost, which is a large radiation field. He said there's a lot of research coming out that shows that those women especially, they develop cardiovascular disease at much higher rates. They develop breast cancer at much higher rates. They develop thyroid cancer at much higher rates. They develop heart failure. And he's like, I don't want to irradiate you if I don't absolutely have to. And this research just came out. And so he's like, my plan is we do all the treatment, we do all the scans. And if your scans look good and your blood looks good, we don't do the radiation. And I was like, that sounds good to me.
Yeah, a longer term view on the possible ramifications of treatment.
And I will say, I didn't always have my whole family and support system on board because, of course, with that, there comes, it's like risk benefit weighing, right?
Right.
It's safer, to do the more treatment for the cancer, right, in the short term.
Right.
Because, and that was standard of care. That was, for a lot of cancer treatments, there's a standard of care that exists. So they, will kind of follow that until new research comes out to suggest otherwise. But again, not every doctor is staying up to date on all of those things, especially when they're treating all different kinds of cancer, right? So this one in particular, since he had more specialization in blood cancers, he was aware of this. I wasn't aware of this. Like, what would I have known, And if I didn't get those other opinions, I would have done the radiation. And not that I'm against radiation. I don't mean to sound, in that way, in any way, shape, or form. But, I'm sure we'll get into this later, but I don't know that I would have physically or mentally survived more after my other treatment. So I don't know how that would have gone for me. So I'm really grateful that, I did that. And I really recommend, even my patients when they're seeing me for, whether it's like adjunctive cancer support or other things. I'm like, this is what I think, but I welcome them to go ask somebody else and get another opinion. And I need them to feel like they're comfortable with whatever the plan is, and that they feel empowered in their own health. And whether it's they see someone else or they see me, at the end of the day, if they're happy and their health is being well taken care of, that's what I care about most. So, yeah.
Amazing. Amazing. Yeah, I think that's such an important aspect of just, giving people the options available to them, whether that be conventional care, whether that be alternative, whether that be some kind of a combination of both of those. And I think, like you said, there's multiple factors, and I think it goes, down to, we all have our own unique values. We all have our, you had mentioned, the fertility piece that he just threw in there. So I think, yeah, I think that is a really important part. And I'm glad you mentioned that, of just, getting more opinions than just one, and then making it a or as informed of a decision as possible based on your values, your beliefs, how comfortable you are with the different treatment modalities, because there is that, I'm sure, that pros and cons to any intervention out there, whether that be conventional, whether that be more alternative or quote unquote natural. So at this point, you are feeling much better or more in alignment with that practitioner. And then maybe let's, walk the listeners through the actual treatment journey.
Yeah. So again, I know I mentioned not everyone in my support system, which I did have an amazing support system this entire time, but was on board with all the decisions that we made. So that was another unique challenge, which I think we often don't think about, because you're making decisions for your health, but of course your loved ones, your parents, your siblings, they all want what's best for you as well, and they want to be involved. And so with the decision that we were going to go with this person who wasn't going to do the radiation, there was some concerns. And then, my husband, who at the time was my fiance, there was also a lot of concerns related to the fact that, I didn't mention this in the beginning, but our wedding at this point in time was only 5 months away. So we had already, planned our wedding, paid for everything, sent the invites, got the RSVPs, and my diagnosis came, 5 months before the wedding was supposed to happen. So, I always say that, getting the news of a life-changing diagnosis, whether it's cancer or otherwise, never can come at a good time. But it definitely wasn't a good time, with our marriage, wedding coming up, being in my first year of medical school, finally feeling like I'm pursuing what I want to do in life. And then, this happened. So we decided to keep our wedding as it was, because my doctor at the time said, because we asked him, like, what do you think we should do? And he said, well, you have kind of two options. Your option one is you leave it as is. And your option two is you postpone it for 2-3 years from now. And we were like, 2-3 years? My treatment's only going to take 8 months. Like, why would we be postponing it that long? And I remember him telling me, and this was another kind of a moment that's very solidified in my mind. Like, I remember this conversation very clearly. He said to me, you're young and you're very healthy, and the prognosis of this cancer in particular is generally good. My subtype was, not so great potentially, but still there's like a 80-85% survival rate, which is good. When we think about cancers and look at the statistics, that's good. Although I always say, well, if 15% of people are still dying, I don't think that's good. But that's just,
Sure.
my take. But I remember him saying, this treatment is not going to be easy for you. Of all the cancer treatments that I do for, chemotherapy and otherwise, this is one of the worst to go through. You will not do well, and it will take you a long time to recover after and to feel like yourself again. And I remember thinking, this guy doesn't know what he's talking about. I am so healthy. I do all the things. I'm so strong. I was an athlete. Like, I'm resilient. I'm like type A determined. Like, I will do the things and I will be like, okay, and I'll go through this okay. And after, I'm going to be okay. And like, we'll have our wedding if we did push it back, like not that far, Ultimately, we decided to leave it as it was because, we felt like we were ready. And, we also had some, I don't want to say pushback, but some just concerns. And, that was hard for me too. Like, wow, do you guys really want to get married with all this stuff going on? Maybe is it wise to see how you get through this? A lot of couples struggle when one person is going through cancer, which for us, that was like not even a question. We're, in it for the long run, even at that point. Right. So we decided to leave it as it was. But yeah, I think the other thing that came up at that time, like you mentioned, was the fertility thing. So and there was some concerns because in order to go through fertility preservation, it would have delayed the start of my treatment because you can't do chemotherapy while you're for women, it's like egg retrieval, so you can't do that at the same time because it essentially the chemotherapy like turns off all of the hormone function in the body pretty much. So, we decided that we wanted to do it because we both really wanted to have a family in the future. That was important to us. But it meant having to delay the start of my chemo, which, given where my illness was at, there was just concern. And I understand that as well, because I think when people who love you are concerned that you may die, they just want you to live, and at whatever cost. And, we felt, my doctor felt it was okay that we, that it wouldn't make or break things for us to delay a month. We ended up delaying 2 months because we did 2 cycles of fertility preservation. But that was our decision that we felt we had to live with. And I think when you're in these situations, it's hard because you can't make everyone happy. But at the end of the day, you have to do what feels aligned for you and your life, and take the risks you're willing to take, so to speak. So we didn't feel that we were taking a risk that would, totally threaten my life. Of course, it did a little bit, I guess, but weighing that with our desire for a future family, which is interesting now because I recently learned, at the time they thought that the treatment I went through had a very high chance of infertility because of what had been studied, what they knew of research at the time, with a lot of different chemotherapy regimens. But they actually now know that it's only 10%, which they've only discovered in like the last year or two, of women who, can't have children after the treatment that I went through. So hindsight's 2020. Now they don't really counsel patients as strongly. They still tell them about the risk because it's 10% is what we know now. But at the time they thought it was much higher. So, so we, that's another whole process that we knew nothing about. We'd never looked into or thought of. I was in my late 20s. And so it's another big challenge that I think young cancer patients face that people don't often think about or talk about because the cost of fertility preservation, it varies, but it can be anywhere $15,000 to $25,000 for one cycle. And a lot of insurances don't cover that. Some do now, especially in California, but in the time we were living in Chicago, so things are different there than they are here. Our insurance did not cover that. And so, it's kind of embarrassing to admit it, but we ended up doing like a GoFundMe because, we shared our story, and because we quite frankly didn't have, $50,000 cash to do that treatment. And we had to do it immediately. So it wasn't like we had time to get the money to do it. And we didn't want to just have our parents we didn't feel comfortable with that. So we, shared our story online. It was at the time really embarrassing for me. It still is kind of embarrassing for me to talk about because, I'm the type of person that I don't like to ask others for help. I've gotten better about that. And that's one thing that this cancer journey totally taught me to be okay with asking for help and receiving help, because when you're going through something like that, most people end up needing it in some way, shape, or form. And so that was very humbling for me. It was really difficult. My, husband was the one who was really encouraging me to not be ashamed, not be, embarrassed to need that help. And, we were so blessed that our friends, family, church community was so happy to donate to us, and we were able to do that. And the other thing I just want to share in case it's helpful to anyone else going through this is the Live Strong Foundation also does donate a certain amount of money to fertility preservation for people who are diagnosed with cancer, which we also found out. So we were able to get some money from that as well. Yeah, which was huge. But yeah, so that was just another unexpected thing. And, it was a really awkward time for me because I remember going to the fertility clinics and doing all the things. And you have to go in every other day to get your blood drawn and get ultrasounds, and you're doing injections at home. And so what a wild time, because I was not feeling well. I was really sick. I knew I had cancer and I needed to start my treatment. And I'm doing all these hormone treatments on myself, which, my husband will tell you made me a little emotional more than I, probably already was, all things considered. And because it's pregnancy on steroids, hormones wise. And I'm going in, and the fertility clinics, they're so wonderful and they're so sweet. And they're oh, how exciting. And I'm like, I have cancer and that's why I'm here. And, I didn't say it like that, but it was it wasn't the same, exciting time. It was a very, how did I get here? What's going on? I can't believe this is happening to me. It was
For a lot of emotions.
just very strange to have that shift so quickly happen. Yeah. And we did that, and after, those were done, we did 2 rounds because this, I don't know how much detail you want to know, but what happened was, essentially when you do fertility treatments, they recommend for fertility preservation for cancer, the best way to have the most robust chances are to preserve embryos essentially. And so in our first round, we got a good amount of eggs, and then my husband, they did semen analysis testing to identify what would kind of be the best chances for us to make good, robust embryos. And they discovered, some issues with his sperm at the time. And, my husband he's a very competitive cyclist. And at the time he was biking a lot, and he does long distance endurance biking, which is not good for fertility. And so basically they told us, we identified all these issues. We can't use his sperm right now. It may be because of the intense cycling that he's always doing, right? We don't really know, because of course that triggered a whole nother thing oh no, is there something going on with his fertility now? Another whole health thing we weren't anticipating. And, the doctors at the time really counseled us that we didn't have to be alarmed, but essentially he would need to stop cycling for about 3 months. And, he was doing sauna and all the things you're not supposed to do for sperm health. So, so we're well, we don't have that kind of time, so that's ultimately why we ended up doing another cycle, because the eggs themselves are not as resilient and robust when you freeze them as an embryo is. So that was another whole, wrench thrown into the mix. My poor, amazing husband was what's going on? And, another unexpected thing. But I think when you're going through these things, you're uncovering new things all the time that you don't expect. And so that kind of prolonged, when we started my treatment a little bit more. It took about a couple months till we got started.
Wow. So things that were ironed out enough on his end then after stopping for, it seemed like another month. Well, you stopped and then you tried again.
Well, they said that that wasn't going to be enough time, essentially. So we did another round just to get more eggs, essentially.
I see.
Yeah.
I see. Wow. Yeah, definitely another rush thrown in. Time is of the essence at that point.
Yeah.
Wow.
And we weren't going to wait like 3-4 months and then do 2 cycles. That they said, like, my doctor was like, I'm not going to sign off on that. I mean, of course you can choose to do that, but like, I don't think that's a good idea for your health. So we decided not to do that and listen to his advice on that one.
Goodness. So at this point, you've at least extracted some eggs. You're, on at least doing as much as you possibly could have done at that point in terms of preserving fertility. And then, so at this point, then you start the actual cancer treatment.
So at some point in there, I had my surgery to have my port placed in my chest, which is where they administer the chemotherapy. And then once the fertility treatments were done, I started chemo for me, which was every 2 weeks. It was supposed to be 6 months, but there was a couple times where I couldn't do it either because of my counts or I was, too ill, or we, ended up after our wedding taking a honeymoon. So we like moved it back. My doctor said it was okay, but so it took a little bit longer for me to get through my whole treatment. But every 2 weeks, and it would take about, it would take the most part of a day. They would, do pre-drugs before they would administer the chemo and then some medications after.
What was that like? That process of going through that?
Yeah, to be honest, it was pretty awful for me. I was very ill from the chemotherapy, from the very beginning. I also was like at this point really like fatigued, sick, like my lungs still kept filling up with fluid. I was still having like exercise intolerance, so I was very fatigued and weak and just not feeling well. And the medications that they would give me, also like I just didn't feel like I was functioning normally. So I would have, and I would get really sick after chemo. So I always would have somebody, which, again, I'm so thankful for our community, our friends and family. I always had somebody drive me to my treatment, stay with me for the day, and then take me home after. I remember that I reacted, negatively to one of the chemo drugs. I started having like an allergy, which eventually later I did have like an anaphylactic reaction to that, landed me in the ED. So I was on like really high dose steroids for the majority of my treatment as well, which, as have a lot of side effects as well. So yeah, after my treatment, I would, feel pretty sick. I had a lot of side effects from it, a lot of the typical things you would think of, like nausea, vomiting, GI issues, so constipation or diarrhea. One of the drugs is the one that people know, causes you to lose your hair and lose your eyelashes, eyebrows, all that. And, I know now as a doctor, and I work with a lot of perimenopausal and menopausal women, it stops, all your hormone production essentially. So I went through menopause like pretty quickly in my treatment. So I was having like all the menopause symptoms you would think of pretty abruptly, because normally when we transition naturally into menopause, we have hormone changes for quite a while. And I went from like pregnancy, hormones from the fertility treatments to like nothing, So, Travis will tell you I was probably emotionally not my normal self at that time either.
Imagine so.
Yeah, and so I mean I developed all sorts of side effects from my treatment. I would get skin rashes, I had mouth ulcers. One of the like allergic type reactions I developed to one of the medications, because then they would give me a lot of medications to counteract the side effects from my treatments, right? They also gave me, I did take like mental health related medications at the time because, as I went through my treatment and the more sick I got and the worse that I felt and the worse that my side effects were, after like months of dealing with that, I was having a hard time sleeping. I was really anxious. I would get really anxious to go to my chemo because I knew how sick I was going to be. I don't like, as a naturopathic doctor, I'm not against medicine or conventional medicine or anything like that, but I don't like having to take a lot of medications. And so just the thought also of having all of that being put into me, I did have to do a lot of cognitive reframing around that, which, my oncologist worked with me on. I did a lot of therapy during my treatment, which also helped me. But there's a book I read called Love, Medicine, and Miracles by, I think it's Dr. Bernie Siegel. We'll have to double check that. But, one of the things he talks about is like the mindset. And so I had to do a lot of like reframing because I think that, chemotherapy, people say, it's poison, right? These drugs, they're poison. And in a way it is, it's poisoning the cancer and it is poisoning other things as well, which is why you get a lot of side effects and symptoms and don't feel well. But I had to, for me personally, visualize that it was like, the way I decided that worked for me was like little, balls of light that were going to kill the bad things inside my body. Because if I thought, oh my gosh, I'm putting all this poison into myself, I'm poisoning myself, it caused more anxiety and more stress. And I didn't feel that that was going to contribute to my healing if I was thinking about it that way. And I really believe in the mind-body connection and the power of the mind to heal. And I think, during that time, like my treatment time and after treatment was definitely like the worst time for me. Physically, emotionally, I got, other issues that came up like randomly from some of my medications. Like I remember I had this weird, I joke a little bit now that I do get nervous if I ever do have to take a new medication or something like that, because when you read the inserts on medications, and they tell you like millions of things that can happen and side effects. And, a lot of them are like 1 in 500,000 or 1 in a million. Well, I got some of those, very rare side effects. And, we know with precision medicine that has a lot to do with like genetics and genomics and all these things. So, I had this one side effect and they ended up not giving me that medication anymore, where I remember like it felt like all my teeth were falling out and I had like such bad nerve pain in my mouth and I couldn't even like drink water because everything hurt. And it was like 10 out of 10 excruciating pain. And I had to go to the ED for that too. And they had to give me all sorts of stuff because I was like in such extreme pain. Yeah, I don't know if I really answered your question, but the treatment time was hard. I usually would feel pretty bad the first like 3 days after was the worst, and I would sleep a lot. But then around day 4 or 5, I'd get a little bit of energy back. And, I didn't like being on a lot of medications, so my side effects were so bad. I had to take a lot of things to kind of manage. And, I was doing natural things as well, but to kind of manage all of that.
Yeah, so maybe let's briefly touch on that. I think I'd like to get on that, touch on that topic a little bit more later. But what kinds of things were you doing from a synergistic or an alternative standpoint in conjunction with the chemo?
Yeah. So, I mean, definitely for the mental piece, like therapy, I know we'll get into this more later too, probably, but there was a cancer resource center that I went to that I also found from like, when I was going through this, I was looking up everything, Googling things all the time. And I'd never heard of these places, but there are places called cancer resource centers that exist to provide integrative, support to cancer patients and their families for free. And there were 2 of them nearby me. So I went there for therapy. I went there for group support sessions. I did reflexology. I also, they had like workout classes there for cancer patients. So I would do exercise. And I feel like, throughout the whole experience, I would always try and get outside and do grounding, go for walks, no matter how bad I felt or how fatigued I felt. I would try to do that every day. And thankfully, like my, husband and my mom spent a lot of time with us too when I was sick. And they would, when I wasn't feeling well, kind of light a fire under me, so to speak, to like get outside and go for a walk. And I feel like being in nature and moving really helped. I also tried to do things like for some of the side effects, like, using like ginger tea for the nausea, doing like arnica gel for like I had a lot of joint pain. I did use, like supplements and things like that as well. And of course, like diet, and I'm sure we'll talk about that as well.
Definitely.
Yeah.
My question, what I'm thinking about is, I guess, where your head was at, and just on a day-to-day basis, knowing that the next round of chemo was, upcoming, um, and so at this point where were you at in medical school? So you were taking a leave at this point?
Yeah. So I originally, before I started, as I said, I had this perhaps false sense of strength. And I thought I would be able to stay in school the whole time. So I initially I tried to go to school still like full time in my treatment, but eventually like the school I was at had options to do like part time, essentially like less credit load. So I ended up, doing that during my treatment, and towards the end of my treatment I actually took some time off because I was really not doing well, but I was trying to remember the specifics of this and talking about it with my husband, and he was telling me that I was so determined. I really didn't want to stop school. Even if it meant, like, I think before I went on leave, I was only taking like 2 classes or something, but I needed something
Right.
to keep me going, to have something to look forward to feel like I was making progress towards what I ultimately was wanting to do with my life, and to, get me out. Because I think the other thing that we often don't think about, especially for young adults with cancer, but anyone with cancer, is that, it can really put your life on pause. And when you're so sick, like the way I kind of remember it is like, most people can remember the worst they've had food poisoning or the flu or COVID or whatever it may be, like the worst sickness they've ever had. To me, my cancer treatment was like feeling like that, but for months. And
Wow.
after a while, you're kind of just like, how am I gonna continue like this? Because you're really just feeling so unwell, suffering in so much pain. And I think the other part of it is, that can be really isolating because it doesn't make you want to go out. It doesn't make you want to see people. Also just as a woman, having lost all my hair and being on such high dose steroids, like I developed, essentially like a Cushing's presentation. I was super swollen. I gained about 25, maybe 30 pounds. None of my clothes fit me. And I just remember, not wanting to really go anywhere or talk to anyone or meet people because I really just didn't feel like myself at all.
Right.
The person I'd always known myself to be. And I didn't want to show up in the world like that. And I didn't want to, my husband is very extroverted and always meeting new people. We're always going places. And the other piece is, like when you go, when I would get my chemo, I would alternate every other week with a doctor visit. So I'd see the oncologist in his office every other week, and he would run blood work, do physical exam, check in with me, kind of see how you're doing, right? I remember, just every time you go in, they have you fill out the GAD-7, PHQ-9, the questionnaires for anxiety, depression. And I just remember like, I've never in my life had really severe anxiety. Like I've had, ups and downs with it and, related to school or life stress. But the anxiety I had and the depression I had was really difficult at that time. And I remember too, you see your blood work in those visits and it's 0, right? And they tell you, essentially to be fearful to go out to do things. And I see patients like that. And
Joe about your white blood cell count.
and I see patients like that now, and they're so isolated. They're so, mentally unwell, physically unwell, and they're afraid to go out. And I'm grateful that I had, at the time I was not grateful. At the time I was angry. But my husband was like, we need to go to church. We need to go to this event. We need to go to this thing. We need to. And I'm like, I don't want to see anyone. I don't want anyone to talk to me. I don't want to explain what I'm going through to people I don't really know. But I see, cancer patients or even like survivors in Africa are still on long-term meds, and they're so afraid because of their white blood cell counts being low. And I understand that and I respect that, but there's so much importance for relationships and community, and being isolated for that long, I think is not good for mental health. And everyone has to take their own individual risk with that, what they're comfortable with. But it's hard because even some of my patients, when I want to recommend going to a gym or using a sauna or things like that, they're afraid. They're afraid to be, vulnerable to anything, but then they're just isolated and alone.
Yeah, I think we learned a lot of that through COVID for all of us. Just the detrimental effects on isolation. Yeah, I think that's really underappreciated or under talked about piece of the cancer journey is not all, we all know of the chemo and losing the hair and how bad that, people feel during that. But I think just it really compounds the mental, emotional, spiritual, social components of it in terms of, what you just mentioned with it, which I think is critically important. And I think I'm just as a practitioner in general health and, seeing a lot of people with mental health conditions, anxiety, depression, without the cancer, how important the community is, how important, friendships are, how important that, sense of connection to the greater community. And so I think, we're just starting to learn more and more about the physiological impacts of community, what that does to our immune system. I think, we know the mental, emotional practice of medicine, that's exploring the connection between our thoughts and our immune health and so forth. And I think we're just, becoming increasingly more aware, thankfully, of that relationship between other factors, i.e. the community, friendships, connections, our sense of purpose, things of that nature, and how we, in our physical health. So I'm glad that you said that. And I think, yes, it is that fine balance of, okay, my white blood cells are, next to nothing. So there is a higher risk, but, it is weighing that. How did you weigh that? And how might people think through that, when I'm sure, I don't know if the recommendations are from the oncologist, do not go out and do anything or see people. How should people, or how can people maybe think through that decision and how, come to a conclusion of what feels right for them?
That's a great question. I think when I think back to this too, it was before COVID. So I think things are different now because I do feel like most of the patients that I see, the recommendation for them is to not go to places where there's a lot of germs, like a gym or a social setting like a church, or anywhere where there's a lot of people, or potential exposures. And I think that's probably more increased because of COVID. I was advised to not do some of those things. Again, my oncologist was a little more open to things, I think. And so, I always talked with him about it. But even the fact, we had a big wedding and we had hand sanitizer everywhere and it was outside. But, my blood counts were 0 and I was going through chemo at the time. And we still had like a 200 some person wedding, and I got on a plane and went on a honeymoon, which is like not advised to do, right? And I think part of that comes from, again, my husband. He's more like, it's going to be okay philosophy, you know, more open to those type of risks. And you know, thankfully, despite all the things that we did, I never, you know, got seriously ill in terms of like other infections superimposing, I would say, standard, you know, guidelines. They typically will advise people to not. So I guess people really have to weigh the risk benefit of that. And I think for us, you know, it was really hard for my husband this whole time. So if we would have really had to isolate, and he would have had to isolate as someone who's very social and an extrovert, and not had a community to be with us through this, you know, it was really hard for him. I don't think he would have, you know, been able to handle everything as well. And, you know, it was important for him that we do things together as well.
Right.
And I think it's just hard because at the time, you know, I didn't want anyone to know what was going on with me. But of course, like, they look at you and they know something's going on, right? And we did have so many wonderful people that were so sweet and loving and kind. But I think, you know, sometimes in life, it's also, there's these things that stick out in your memory sometimes are the negative things. So I remember, you know, I did have a lot of apprehension about going out in public, doing social things. And I had only a couple experiences where people said something to me. One of them was, you know, someone that I went to school with actually, you know, said basically something to the effect of like, wow, I can't believe, you know, you feel comfortable like going out in public, like looking like that essentially. And, you know, and then it kind of made me question, like, should I be going out in public? Like, you know, I had a hat on. I would get hot flashes because of the, you know, menopause or whatever. So I was hot all the time. I didn't like wearing the wigs because I would like get hot and sweat. So I wore hats a lot. I just remember feeling like maybe he's right. Like maybe I shouldn't be going out, you know, and I don't think that now, but I think, you know, sometimes people not only feel concerned for their health, but they also feel like, are people going to judge me? What are people going to say? And am I going to have to explain everything? And they don't, you know, they don't maybe want to talk about it. They just want to go out and see their friends or do something in public. And, you know, like I would go to the gym sometimes, and that I didn't do anything, you know, intense because I wasn't like physically able to, but I would do classes like yoga or, you know, things like that. And people were generally really kind. But I also remember, this is fasting forward a little bit, when my hair was growing back, it was kind of like yours. And I just like rocked it like that. I didn't care. When I had some hair, I was like, whatever. And I remember a couple times people like thought I was in the military. And I had someone one day at the gym come up to me as I was like lifting, you know, probably like 5-pound weights or something. But they were like, thank you for your service.
Oh my God.
And I was like,
Too funny.
you know, I told him, I was like, oh no, I just had cancer. And Travis, my husband, he's like, don't say that to people. And I'm like, well, but it's true, you know, like I'm not trying to make them feel bad, but they're also thanking me for serving our country, which I didn't do. And, you know, sometimes that's why people have shaved heads, you know, so.
Well, on that note, I think that's really, I'd like to dive a little deeper into that, and maybe if you could give some advice to, you know, your former self back then, or, you know, somebody else in a similar situation, both so the person with the diagnosis, you know, kind of how you wish you would have thought through that in terms of the, you know, not wanting to, you know, be seen in public and some of those emotions, that apprehension that was coming up. And then also on the flip side for, you know, other people, you know, what things would be beneficial to say to somebody in that situation, or maybe on the flip side, not to say.
Yeah. I would say, you know, one thing that I did kind of get a lot that I would wish that maybe people wouldn't say or advise people to not say. And another kind of resource that was really helpful to me at this time, there's this group called Stupid Cancer, and it's a nonprofit that's available for any young adults with cancer. They define that as 18 to 40-year-olds, and they provide a lot of services, everything from like support groups, events, online things, meetups, online meetups, conferences. They have merch. They do a lot of different stuff. They have scholarships. And anyway, I met a lot of people through that who were also young adults going through cancer. And it's kind of funny because you share stories and you hear, what their experience is like or what they're dealing with. You vent about things or whatever. And one thing we all commonly would talk about that would kind of come up a lot is people will often ask you, why do you think you got cancer? Or like, what do you think you did? And I think the issue with that question for someone who's going through that is it really feels like you're telling them it's their fault.
Right.
Which it may be. I mean, we don't really know. Like, maybe I did something. Maybe it is my fault. Maybe I, did some bad health behavior and that's why I got cancer. But we don't really know that. Of course, we know that like smoking is associated with cancer. We know that like drinking a lot of alcohol has a higher risk of cancer, or even now alcohol in moderation. Like we know there's things that are associated with getting cancer. But when someone gets cancer, we don't know what was the one thing they did. Why did they get it? And so it also puts you in a position to, I definitely reflected on that a lot, and I still do. And at the time, like I tried to figure it out. Like, what did I do wrong? What did I not do that was good enough as like a very health conscious person? And I have identified areas of my life that now I work on more adamantly, or I treat differently than I did before, because maybe I didn't. If I look at, we talk about in naturopathic medicine, the determinants of health, or all of our aspects that make up our health and our health behaviors. There were certain areas I definitely didn't prioritize as much or focus on as much. But I think that, no one can really ever know the why, right? And I think that we have to free people from that. I think we can't blame them. And I think also people ask that not from a bad place, but I think often people ask that because they're worried for themselves, or their loved ones. They're like, right, I want to not do the thing that you did because I don't want that to happen to me, But no one really ever has a good answer to that, right?
Right.
So I think, if we can avoid unintentionally making someone feel blamed, or that it was their fault, because I do think a lot of patients also carry that weight. Like they blame themselves, they feel like something's wrong with them, or they're defective or something. And I mean, that's not healthy mentally or physically to kind of live in that space, or to feel that others are always going to think that about you. And I think, what we can do, or, and everyone is different, so this may not be the thing for everyone, but man, I had so many people that I didn't expect to show up in ways I never could have imagined in that season of my life. And I'll never forget it. I had people that I knew from childhood that I maybe wasn't even that close to, one woman in particular wrote me a handwritten card every week the entire time of my treatment. Why did she do that? I have no idea, but I can tell you it made a huge difference in my life. And it helped me keep going when I felt like I couldn't, I had people also provide meals for us, which was huge. So I think that's something you can always do. Show up with food, show up with healthy food, We had people just say, hey, do you want some company? We'll come over and hang out. Like, I think just showing up in whatever way you can, whether it's a card or a note or a text or a meal, or offering to drive someone to treatments. I think, a lot of the time people don't want to ask for help, or they don't want to say that they need help, or they don't want to be seen in their worst and most vulnerable moments. But I think, and I was very humbled, and, my pride took a lot of hits because people saw me in awful moments where I didn't have it all together, and I looked like, really awful, but it's like, what Travis, he's very wise, my husband. What he would always say is, you have to let people love you. Just let them love you. Even if you're not perfect, like, just accept it, because we often don't want to, oh, I don't deserve this. Oh, I feel bad if they do this. Oh, I'm not doing anything in return. And it's like, we all have opportunities in life to help and support and give love. And when people are offering it, just take it, Yeah, and I think just, what can you say? Just, I'm here for you. Do you need anything? I'm thinking of you. I'm sending you like positive thoughts and prayers. Yeah.
Empathy, compassion, showing up. Yeah, that's the I love the handwriting cards every week. That's really
Yeah, and I'm like, I didn't even really know this person that well, but like our story just touched her and she just, I mean, man, I looked forward to those cards, I really did. And I put them up on my wall. I also had like on our fridge, I had my doctor visits and my chemo treatments as like a little check every time I checked one off. That kind of really helped me. And, I feel like finding little things that, make you laugh. It's a little bit of a dark humor because it's kind of a dark time for me. Like I had, I got this is probably embarrassing to admit to, but I got this like huge poster, like the size of me of like it's a cat, the cat hanging from the tree and it says hang in there. I got that to like motivate myself. I got these like funny shirts that, it's like you just do little things to try to get yourself through. And I another thing you can do that a lot of people have reached out to me about is what was helpful for you during your treatment, like that I could like put a care package together for someone. So, I did like the little anti-nausea bands. Like I mentioned, like ginger tea and chews and, like comfy little socks. Cause when you're sitting in the chemo place, it's freezing cold. Like little head scarves, like, just, you can make someone like a cute little care package. That's like a sweet thing,
yeah,
I think people appreciate that.
definitely. And then I think, well, you may have mentioned this, and pardon me if I missed it, but the other side of that was, or that I wanted to ask you about was, what can people do or how can people think through, so the person that has the diagnosis and in terms of being able to break past or break free of that vulnerability of, being seen in, a physician that they might not feel very, good about themselves in, or how can people think through that or kind of break through their own, personal, whatever you might call them, like beliefs or, patterns of not being able or not being willing or able to accept help or to be seen in that light.
That's a good question. I mean, you want to respect people's wishes. But I will say there were times I said no to things and people did it anyway. I don't think I was upset by it, but I think it was like more my pride. So, people would reach out to my spouse, and I think, he would kind of guide them a little bit better than I would because I had a really hard time accepting help from people. So, I think it's a fine balance because you want to respect, someone's wishes. But I think if it's obviously it's different from like, someone who just has depression or something. But it's like sometimes, they need someone to just show up.
Right.
Right. And my mom, she was living a couple hours away from us at the time, but she came down every week. I didn't want her to. I felt bad. She would, clean our house and cook and force me to do things I didn't want to do, like go for walks and, I didn't want to do at the time or go to the mall, I'm like, I don't want to go to the mall. Why would I go to the mall? Like, I have no interest in that right now, and she's like, we're going to go shopping, but I'm glad she did that. Yeah. And so I think, there's a fine line. You want to respect people, even if they're saying no, but I think a lot of people will say no because they're ashamed, embarrassed, depressed, or pride, but showing up, really matters, I think.
Yeah. I'm just thinking where to go from here. So I think at this point, you're in your treatment, things are progressing. You're thankful you have a amazing support network, thankfully at that point in time. And then was it this several year journey that your oncologist had predicted in terms of you feeling back to yourself again, or walk us kind of through that, the rest of the treatment, and then kind of back to normalcy, and then picking up the pieces, getting back into medical school, and walk us through that.
Yeah. So he was right. I didn't do very well during my treatment. I was yet again very humbled. My pride was not correct. I was very unwell, and eventually, I went part-time in school, and then eventually I took a medical leave from school because I was really not doing well physically, mentally. I had really severe brain fog. Like, I just couldn't really think. My memory wasn't there. I was really scared at that time too, because I would forget conversations, forget what we did the previous day. Like, it was like I don't know what it's like to have dementia, but I was, and I'm a very high capacity, high functioning, like type A overachiever, you know, firing on all cylinders. So I was firing on no cylinders, and I was like, I can't do school, And so at that point, I really questioned everything. Am I ever going to be able to go back? Am I ever going to feel good again? Am I, ever going to be myself again? Like, looking at what I was compared to where I was at, I didn't recognize myself physically. I didn't like who I, was emotionally. I was, very depressed and anxious. And throughout the cancer journey, one thing I didn't mention is you also have like periodic scans. So I remember very early on in my treatment, I think it was after 2 cycles, they do a preliminary scan just to see how you're responding. And, we were very shocked. My doctor was very shocked that after that first scan, there was actually no evidence of disease in my body, but I still had the majority of my treatment to do. So I remember trying to negotiate with him. Can I just stop my treatment? There's no evidence of disease. Why would I put myself through this? Oh my God, I'm healed. Praise the Lord. Like, I was just like, and, we know this, but when you look at like cancer physiology and biology, there's even things like that I know can cause a lot of anxiety for cancer patients to talk about, or cancer survivors, but like cancer stem cells in the body, that's not going to be picked up on a PET scan. So to give you the best chance of not having a recurrence, the evidence supports doing the entirety of the treatment, right? And so if you leave early, there's a lot of evidence that even if there's no evidence of disease early on, they'll have a recurrence because of kind of microscopic stem cells in the body that, if conditions align for them to kind of proliferate again, now you have a recurrence. And the issue with recurrence is sometimes your body's now adapted to the treatment you were giving it, so you may not respond as well. So there's all these nuances. So I remember being very happy and then being very devastated because I thought, I can't believe I'm going to do this to myself when I don't really feel like I need it. But also the anxiety and the stress of not doing it, made us decide to just continue with the course as planned. But we were very happy to see that result because despite, and my doctor, I remember he was quite shocked himself at the time because they had thought that I wouldn't potentially be that great of a responder.
Right.
And then I responded so well. And so I told him, I attribute this to all my integrative things I'm doing. On top of it, he's like, well, it can't be hurting. Like, look at the results, keep doing what you're doing, So I'm like, okay. And of course, I believe in, God and his power to heal. And I believe that, he had a, large role in that result. And I'm so grateful for that. And, I think that as we kind of went through the rest of that treatment, when I eventually kept going, I continued to decline and took time off school and then questioned my whole life, like, will I ever be able to finish school or go back? So I really, went into this time of, well, what am I going to do with my life? Because my husband was working full time. I was just at home since I wasn't in school. And once I finished my treatment too, as much as I didn't like having, to go to treatment one week and then my doctorate the other week, there was like a pause in that. So it was like I really had nothing to do and nowhere to go and just myself.
What was that like, being a driven type A type person?
It was really awful. I think, I mentioned I was like mentally not well. So I was on a lot of medications, like conventional, antidepressants, anti-anxiety medications. I was taking things to help me sleep because I wasn't sleeping. And I'm like, I know I need to be sleeping and I need to be healing and I need my brain to function again, but I can't really think clearly. So I started kind of researching like everything under the sun of like, okay, if I drop out of school, at this point I had finished like 1 year, essentially, maybe like a year and a half. I might have that off by like a slight amount, but it wasn't like I had done, 90% of school. So I'm like, well, maybe I just like get my nursing degree or I get my master's in public health or I go into research and maybe I research cancer. Like it was like I really had no idea. And so at that point in time, for whatever reason, we also had another life thing that happened. My husband had been laid off from his job towards the end of my treatment. So he was dealing with a lot of stuff, trying to figure out like career stuff and, dealing with his own challenges with that. And we both were like essentially free. They gave him like a severance package. So he was still going to get paid for X amount of months, but didn't have to go to work anymore. And so he was like, you know what we should do? Like, we should just travel and we should just like go on some like long weekend trips and like, because our plan originally was like, I'll go to med school, I'll finish med school, and we'll move out west. And he's like, we should just go out west to different places and like figure out where we're going to move eventually. And so we took some time to do that, me very much begrudgingly, because again, I'm like, I don't want to go anywhere and see anyone. I didn't want to do anything. But I'm glad that we did. And ultimately, that's, eventually what made us come to San Diego and eventually decide that I was going to transfer there. But yeah, I think at the time I wasn't really sure if I'd ever get back to myself. And it took a very long time. Like my doctor was right. I hate to say it. He knows better. He's seen it a million times. So I don't know why I thought I was this unique, special example. I overestimated my own physical and mental strength. But it took me a while. It took me at least, I would say, a year and a half after my treatment to start to feel like myself again. And in that time, I was eventually, when like my mental health got a little bit better, which, took a lot of therapy. So after that, I was in therapy throughout, but I started going to like more support groups for survivors. I also started to get involved in like some programs where you can like essentially mentor someone who's going through cancer, the same type of cancer you had, which I found like meaning, because for me, I'm like, not that everything in life always has an exact meaning, but I'm like, I have to have some purpose from this, that I can do something. And if it's not to be a doctor, I'm going to help someone else and share all the things I learned and all the tools and, resources. And so I started doing that. And I also started seeing a therapist that specialized in cancer, which was really helpful, which I also, didn't even know was a thing. But there's therapists that specialize in working with cancer patients or seriously ill people. And that was really helpful for me. Eventually, I think when my mental health started improving, I was able to do more for my, physical health. And eventually, it did take quite a long time and a lot of effort and intentionality, but I started to put the pieces back together and feel like myself again.
Wow, quite the journey. It's such a long and arduous process on so many levels, not just physical, but, spiritual, and then the fertility piece of that and the uncertainty there, and then just, the emotional, and then I think, those life choices as well. What are you going to do, with your life? And I think probably a lot of listeners can definitely resonate with some or all of those challenges. Um, and I think you mentioned just the finding support, or finding meaning. I think in the last podcast episode I had mentioned Viktor Frankl's work and his book Man's Search for Meaning, where in a concentration camp he's a psychotherapist, I believe, and trying to find meaning in that experience to then pay that forward to future generations. So I think that is powerful. And I think it's also really helpful for the listeners as well to know that there are just a lot of different avenues for support, whether that is, cancer specific therapist, or whether that's, mentoring somebody in a similar position. I know did that for a number of years, big brothers, big sisters, not a health related thing, but I know how powerful that can be in terms of just giving back and providing that mentorship and support to somebody in need. And then I think, those different support groups out there, and, we can link to some of those resources in the show notes here for people. But I think that's so powerful. Were there any, I know you're an avid reader, as am I. Were there any notable books that you had read, during the cancer journey, whether that's, during the chemotherapy, or whether that's during, the year and a half ish aftermath of that treatment, that were especially helpful for you?
Yeah, definitely. So some of them, I mean, the ones that are more in line with like faith and spirituality, one of them, it's called It's Not Supposed to Be This Way. I can link like I can give you all the information for the titles and the authors too. That's by Lisa Turkhurst. Another one is called Hope in the Dark by Craig Korshwerl. I'm probably pronouncing his name wrong.
Link to those.
Yeah, and then one that I really liked a lot that I still like continue to read is just the Jesus Calling book. And then ones that are not as much related to like faith and spirituality, um definitely, and some of them I think for me I had to wait to read till kind of after. So there's one, it's called like The Anti-Cancer Lifestyle. And I think sometimes like when you're going through cancer and like everything's about the cancer, it's like a little bit triggering or anxiety inducing to like read about cancer or avoiding cancer or whatever kind of when you're in it. But after, so that one I read, after I was done, which has been really helpful for just like reframing. Love Medicine and Miracles, anything by Bernie Siegel. He talks a lot. He was a surgical oncologist. He did a lot of research, and he also did a lot of public health kind of talks and information education on the power of the mind and its impact to, help the cancer healing journey. And he's seen a lot of like miraculous things with the mind body connection related to cancer, and done some kind of more not, randomized controlled clinical trials, but case studies and reports about even how, the language being spoken about a cancer patient during their surgery or things like that impacted their body and their side effects or complications after surgery. Like he's done a lot of really interesting work about the words we speak, the way we think, the power of the mind and body with cancer. So his stuff was really helpful for me. The book The Body Keeps the Score, which I think we've talked about before, just kind of
Great book.
I know we haven't really talked about that, but for me, when I kind of did my assessment of life things and what may or may not contribute to like health issues, cancer or otherwise, definitely like the mental emotional piece and trauma, which that book speaks a lot to. And I didn't really like go into this either, but like before all my symptoms, I did have like some pretty significant trauma happen in my life. I was in like a very, this was long before Travis, but my current husband, I was in a very unhealthy relationship that was verbally abusive, controlling, sometimes a little bit, physical. And it was very traumatic. Like getting out of that, I was stalked for a while and had to change the locks in my house and like all these things. So like that was, a short period of time, but it was like a pretty traumatic thing for me. And sometimes I wonder, of course we'll never know, but trauma can affect the body, the immune system, lots of things. So that as well as like, sleep. I didn't really prioritize that like I do now, being a very high performance individual. And I see a lot of course, those patients like CEOs, high performing, go, go, go all the time. Stress is very high, sleep is very low. And I used to be like that. And I'm not like that anymore. And again, I'm not saying, oh, that's why I got cancer, but I'm like, did that probably help my situation? Probably not. Am I going to continue to live my life like that? I don't think it's best for my health. So turning that off and being more mindful of that and rest and relaxation is something that I think is important. And, that book talks about that and how our bodies can hold trauma and stress and the way they can physically manifest.
Yeah, it's such a powerful book. Because I think we all have, some level of trauma moving through the world that we live in. Some of us, significantly higher than others, obviously. Um, yeah, it's a a great collection, and I think it probably requires that um, multiple avenues, and that's my belief in terms of true healing. It's not just one thing. It's not just going to be the chemotherapy. There needs to be some level of addressing, the mental, emotional, and you mentioned those powerful books and faith or spirituality for those that believe in certain things, and also just yeah, there's just so many levels to it, so it's fascinating. Why did the cancer occur? On a different note, what we all know smoking, drinking large amounts of alcohol can contribute. What are some other contributing factors that we know that people can avoid? And then what are some other factors that people can start to do to just stack the odds in their favor?
Yeah, that's a good question. And I was looking into this the other day because I am a very evidence-based, research-based person. I like to kind of look into those details, especially when giving advice to patients about things. So, there's surprisingly actually research that supports that like having a very high stress kind of baseline is associated with increased risk of cancer. Also, we know that low sleep is associated with an increased risk of cancer. That's defined as less than 7 or 8 hours a night. So starting at kind of like 6 or less. Shift workers have a much higher incidence of cancer. People in high stress jobs like law enforcement, military, as well as like other, you know, regular jobs, but just reporting very high stress. Diets that are low in full foods, diets higher in ultra processed foods tend to have a higher risk with cancer. We're seeing more and more of that now with like colon cancer, but also other cancers. There's more research coming out about that. And one thing I'm particularly interested in is like the debate about organic versus non-organic food. There is a lot of research evidence that shows that certain cancers are associated with some of the common pesticides and herbicides that are used with non-organic foods, as many people know. Um, However, people will argue against that and say, well, there's not a lot of, evidence that it causes all these other cancers besides like certain ones that we know. And so when you look more into that, you'll see that first of all, there is new evidence coming out to support its link to other types of cancers. It just hasn't been identified in, let's say, like large scale human studies yet. But in animal studies, we see like there's, any kind of cancer you can pretty much name is highly associated with a lot of pesticide and herbicide exposure. So you can assume that, you can hypothesize that based off of what we know from that, even though we don't have the human data that we have for other types of cancers. And you can also presume that from the fact that it just hasn't been studied, that doesn't mean that it's safe. So I think often people think, well, if there's nothing to support it, it means that it's safe. Or if there's nothing that shows it's bad, it means it's safe. I take a different approach to that. I'm very passionate about that because, like, specifically with the most common pesticides, a type of blood cancer, non-Hodgkin's lymphoma, has been very much associated with it, so much so that people have won multi-million-dollar lawsuits over the last 10 years. There's class action lawsuits going on. I've been tried to be recruited to join them because they're trying to get also Hodgkin's lymphoma. But the thing is, again, the human data is not there yet. But if and when the human data is there for those things, then, more and more is coming out. So my personal opinion, I do think that, avoiding pesticides, toxins, herbicides does play a role and is important. That's my own personal opinion from my understanding of evaluating the literature that's out there. I think also doing things like optimizing your overall health with lab work and supplements, as needed is really important. I think supporting the immune system, especially now in a post-COVID world, I'm sure you see a lot of this in your practice. I see a lot of immune dysregulation. I see a lot of um, issues of mitochondrial function, and a lot of that is from, whether it's consistent COVID exposures or whether it's from the way that someone reacted to vaccines. We don't really know, necessarily 100%, but we see a lot of immune issues happening, and the immune system is very much involved in, the cancer process. So I think immune support is really important. Even basic things like vitamin D and other supportive nutrients, making sure those are optimal for our immune health. And I think, time in nature, exercise is like, there's a lot of new research coming out about exercise and cancer, which is really exciting. But it's one of the best, tools we have, I think, for cancer prevention and longevity and health optimization.
What types of exercise are particularly effective? Any type, high intensity? There's so much, different, emerging research and thoughts about those types of training. Dr. Gabrielle Lyon talks a lot about, weight training and protein. So yeah, maybe we can get into that a little bit more, and then kind of just spark something, talking about, these high protein diets as well, and some of the mTOR signaling that happens. And maybe we can talk a little bit more about the role of some of those things in IGF-1 and cancer.
Yeah, so I think, it's very complex, and I'm not probably the most expert on all the literature on exercise and cancer, but I do know that overall, any type of exercise is better than none.
Hmm.
So, of course, it's better for certain cancers, certain exercise, like even, for example, doing long endurance exercise, people who are runners. There's an association of much less incidence of colon cancer in that population. Do we know it's just because of that? Maybe not. Maybe they have other lifestyle habits or things that go along with that. But I think there is evidence for high intensity interval training and decreasing cancer risk, cardiovascular exercise for sure, but also newer research is looking at even things like yoga and Pilates and the way that that maybe affects like the neuroimmunological, psychological, stress kind of picture as well as the physicality, right?
Right.
And how that can be beneficial for cancer prevention as well. To your question about the, high protein diets, so it gets complicated here because, um, we talked a little bit earlier about cancer genetics and tumor markers and things like that. Certain diets are beneficial. So, for example, like a high protein diet, or even if, we're thinking about like a ketogenic diet, are beneficial for certain types of cancer. But I think where there is a lot of confusion is that we want to, as humans and as a society, we want like good, bad, yes, no, black or white. So there are certain types of cancers that are insulin sensitive. And that usually tends to be, but not always. And, maybe we want to link some of this in the show notes, like specifics on cancer types, but it could be things like certain breast cancers, certain prostate cancers, those may be more, hormone driven. They may be more of the insulin sensitive types. We're doing a high protein ketogenic type diet, maybe more preventative. And of course, like, the neurological piece of some of those functions as well.
Maybe just for the listeners, kind of explaining, what insulin is and, how that relates to blood sugar.
Okay, great question. Yeah. So essentially, when we ingest sugar or carbohydrates, our body, breaks those down and wants to ultimately use the sugars from that when it's broken down for energy. And in order to do that, our body has to release insulin for that sugar to be kind of like absorbed and utilized by the cells. So, if you're eating a more high protein or keto style diet and you're not having as many carbohydrates and sugars, then your body's releasing less insulin. And your body will kind of use that to fuel ketones and use that as a fuel as opposed to like insulin and glucose. So there are, certain types of cancers that are going to be responsive to that insulin signaling. So for those, going on a more high protein ketogenic style diet may be helpful for both prevention as well as for somebody who's in active treatment. However, the interesting thing, if you look into the research, you'll find that there's actually other types of cancers that are ketone sensitive. So going on that style diet, you may think, because people say, you commonly hear often, sugar feeds cancer, right? And it does for some cancers, but we can't be that black and white. It is more nuanced. And, nowadays with the internet and ChatGPT, and I mean, people can kind of look this up if you're curious, because it is very nuanced. And I don't know every single type off the top of my head, but there are other types that are ketone sensitive. So actually doing that type of diet would feed the cancer more or be more likely to lead to it. And I think the other, concern that I have as a doctor that I'm always thinking about with my patients, whether they're, I do see some, patients in active treatment adjunctively. I do see some patients that are survivors. It's not the majority of my patients that I work with. More of my patients are wanting to prevent things, longevity oriented. They may have a variety of lots of other health things going on. And so some of them are very interested in the very high protein or keto style diet, which I won't say I'm, blatantly against, but the concern there is that when we look at the research and the data for foods that support the prevention of cancer, it's a lot of vegetables, it's a lot of fruits, it's, things that may not be included in that style diet. There's a way to do that style diet and still include some of those things. Can get very complicated, but for someone who's really determined and, there's a way to still include like vegetables, maybe not fruits because fruits are going to have more sugar. But I'm personally hesitant to recommend long-term a diet that's low in those antioxidants that we know are very helpful for prevention of cancer. And essentially, when we think about cancer, one of there's many things. It's multifactorial in its development and its process. But one of the things that happens is we have oxidative damage in the body. And so we want to have antioxidants repair that oxidative damage, because oxidative damage damages our cells. When our cells get damaged, they can become aberrant or do things they're not supposed to do. They can develop into cancer. They can evade, the immune system. But preventing kind of that cascade, one of the ways we could do that is by having antioxidants in our diet, whether it's from food or supplements. And a lot of that comes from fruits and vegetables. And when we also look at what cancers are increasing the most, especially among young people, one of them is colon cancer. We're seeing it more and more in a lot of young people. And we're kind of trying to figure out, well, why is that? What's going on? And some of the main hypotheses have to do with the ultra-processed foods and the lack of fiber in the diet. And so fiber comes from fruits and vegetables, whole grains as well, but a lot of those are high in carbohydrates. And that's going to, so for me personally, that's many words to say. When I'm thinking about longevity and cancer prevention, I'm hesitant to remove so much from the diet that we know that there's evidence about its benefits. But that's just my own take. I don't know I'd love to hear what your take is.
Yeah, I mean, I think, I see patients come in daily on all kinds of different diets. Right now, at the time of this recording, at least, I see a lot of this carnivore type diet. And, I know you're a lot deeper into lipidology than I am, but I still will run a, comprehensive lipid panel on these people. And for some people, you know, I, I think it's, to your point earlier, where there is really not a right or a wrong diet or a black or a white. Um, I think, some people can, come in and tolerate that decently well. Their lipids are still within normal range. And I think that ultimately, with some of these highly restrictive diets, that I know, who was it, Jordan Peterson, I think, talks about, eliminating all kinds of processed foods and basically just doing basically a carnivore diet. I think those can be as tremendously therapeutic for a short-term intervention. However, there is, like you said, not enough long-term data to support something that extreme on a long-term basis. And there's probably some people that might disagree with that, but um, I'm of a similar philosophy of, there's so much literature on a Mediterranean style diet, and I think that the diet that I recommend to most patients for those interested in longevity and performance is some type of a Mediterranean style diet. And you can kind of tweak that whatever way you want. If you're an athlete that's, interested in more hypertrophy training, or if you're, you can up the protein in a diet like that. Or if, you can still, make the tweaks to make that more of a ketogenic style diet where, like you mentioned, you're eliminating more of the grains and the fruits, but you're still getting a lot of volume of vegetable fiber, which, as we know, is really beneficial for, short chain fatty acid production and butyrate and the things that fuel our gut and our microbiome. Um, so yeah, I think it's definitely not a black or a white thing, but I definitely don't subscribe to these more extreme diets, at least in the long run. On that note, why don't we talk a little bit about your thoughts on maybe some of the other natural options out there for people? So things like, I know intermittent fasting or fasting, in conjunction with chemotherapy has been a more of a hot topic. What are your thoughts on, those approaches, whether that's intermittent fasting, whether that's, I know Vulture Longer, I was just at the IFM conference, the Institute for Functional Medicine, a couple weekends ago, and he was there talking about the fasting mimicking diet and the benefits of that. What are your thoughts on those types of, fasts or extended intermittent fasts, just in general, and then, maybe in conjunction with therapy?
Yeah. I think fasting can be a very helpful and useful tool. I think that, when done in certain ways that are appropriate, I think it can be really helpful for the immune system as well as, cancer prevention. So, as we know, when we kind of go through fasting, whether it's fasting mimicking diet or whether it's a true fast, like a liquid fast, um, I believe it's about after 2 days or 3 days that we start to have the autophagy, and so, essentially, that's kind of like our body's cleaning process, right? Like, getting rid of aberrant or, mutated cells and tissues and things and kind of regenerating, so I think it can be, a really great tool. I think intermittent fasting also enables the body to kind of do a little bit of that, although it won't get into the same level that you would if you did like a true, 2 to 3 day type liquid fast. I think it's a really great tool. It's good for prevention. There's a little bit of nuance with it because I think for women, um, and Dr. Mindy Pelz is kind of like the expert on this, but depending on what's going on with your menstrual cycle, if you're having issues with your menstrual cycle, if you're perimenopausal or if you're menopausal, there's different ways to do it that are appropriate kind of for your stage of life and your, hormones. And I think that for men, it's a little bit different because they're a little bit less complicated hormonally. But so I think that's just the thing we have to consider. But she's a great resource and she has a website and book and, so if anybody's interested in that. But I think for the cancer prevention, I mean, There's a lot of evidence for that. The tricky part with treatment is, I think timing it is important. And so, like, different chemo regimens are administered differently. So figuring out how you're going to time that, and in a way, with the way I think about that is it's a little bit more patient specific, because depending on how that patient is handling what's going on, like some patients, like, on my end, for example, like I gained a lot of weight during my treatment. Some patients lose a lot of weight and are, sarcopenic and weak. So I wouldn't personally recommend it in that type of patient, even though it could have some benefit.
Important to note.
Yeah. So I think it depends a little bit. And if they're able to kind of withstand it, I think there's a time and a place potentially during treatment for the right kind of situation.
Yeah, I think that's definitely an important point to note. It is highly individualized, all these suggestions. And obviously, anything we're talking about on the podcast, is for educational purposes only. Just a reminder, and, to make sure to check with your physician, your oncologist, before doing any of this, doing any of these things that we're talking about. I think from what I recall of Walter Longo's presentation, I think it was more the idea um, was more, fasting to make the cancer cells more susceptible to the chemo, to kind of further differentiate, and then have more of a robust impact from the chemo. But yeah, very interesting. And I think we're still probably in the very early stages of the research behind that. Um, what are your thoughts on, some of these other treatments out there? For instance, ozone therapy is a therapy that's coming into more prominence. Things like high dose vitamin C. I'm sure people hear about that a lot. And what are your thoughts on some of those types of therapies, or any others that you want to mention?
Yeah. So as you kind of mentioned, I'm not advising anyone to do anything. This is all just, information, education, and definitely always, talk to your doctor first, especially if you are in treatment, before considering any of these things. And I intended to mention this at the start, but all of the information I'm sharing is my own individual opinions and does not, reflect the opinions of my present employer. But it's just my own thoughts. And so with those therapies in particular, again, I tend to be very evidence-based. So I'm honestly not as familiar or up to date on the ozone research. So that one, I know it's very much like a newer therapy that's being looked at compared to some of the other ones that have been around longer. And I'm not as familiar. So I'd be really curious to hear your thoughts about it. I know it's used for people for a variety of health conditions. I'm a little bit more familiar with the vitamin C, high dose vitamin C IVs, as well as like mistletoe, subcutaneous, as well as IV therapy. So, the interesting thing is that some of those are used as kind of standard in other countries. In Europe and Asia, there's certain countries that use them, whether adjunctively or prior to therapy. There is kind of evidence to support them. I think what a lot of the other, thoughts on it would be on the other side is that there's not enough evidence yet in some people's perspective where it would be incorporated alongside. But, for example, for both of those, there is, you can look at certain studies and we can link them with certain types of cancers like ovarian cancer, prostate cancer, pancreatic cancer. There is evidence that shows that using some of those adjunctive therapies had results on human data, including, as well as a lot of animal data, but results including, tumor regression, decreased side effect profile, um, longer time between when disease progressed afterwards compared to people who didn't get the therapy. So a longer time of, kind of a remissive state, or where the disease was stable and non-progressive, as well as there are a couple studies, not as many, but that look at mortality and saw improvements as well. So I do think there's evidence for them. I know they're often used. I think when people are looking for kind of a adjunctive support, I know there's a lot of evidence for them with side effects specifically, which I think is a big challenge for a lot of people going through treatment. So I would definitely, advise people to kind of talk to their doctor and look into it and see. But, there is evidence to support some of those for sure.
hmm Yeah, yeah, it's fascinating. I think, with we do a lot of IV therapy in our practice just for the general population, not as much so for, cancer patients. And then, just kind of just starting, with the ozone therapy. That's an intervention that's been around in Europe, for quite some time. It's a very safe and effective therapy. And then, with something like that, there's a wide range of different dosing, and that, it's measured by something called gamma, which is a concentration of ozone. So how much of the ozone is actually an ozone being a gas that you essentially draw blood out of the body and then infuse that gas into the bag of blood to ozonate it and then re-infuse it into the body. So there's a lot of different protocols for that and a lot of different numbers of passes, meaning how many times the blood is transported out of the body and then re-infused back in an ozonated manner. So I think there's a lot of different, just with the high dose vitamin C, there's a lot of different strengths, if you will, a lot of different ways of doing that. So I think, at the lower dose, perhaps more of a preventative, both the vitamin C and the ozone. I know one of the mechanisms of ozone at least at a low dose would be an upregulation in our own antioxidant enzymes and those mechanisms of upregulating several pathways. One of those notoriously being NRF2, which is a powerful pathway in the body that can be very helpful for prevention and longevity. But so I think just still on the emerging end of research.
Another thing I'll mention really quick just is less, what we would say like a higher force, but there is a lot of evidence to support like medicinal non, like lower force kind of medicine grade mushrooms. In their both, prevention, but also treatment. And that's something that also in Asia is used like much more frequently for cancer treatment. And so I feel like that's a really interesting thing, for people who are curious about looking into ways to optimize their, health as well as maybe some things that are a little lower force interventions to do alongside. Of course, again, always talk to your doctor. We're not giving them advice, but things like using certain mushrooms. There's like powders and capsules and tinctures, as well as, turmeric. There's a lot of evidence for that as well. And things that we know are really anti-inflammatory, like herbs that we would use, as well as things like garlic and ginger. So I'm a big proponent of those type of things as well for cancer prevention.
Yeah. And on that note, just a question that I've always wondered, or be happy to get your thoughts on this. How much of I'm sure this is probably a tough question to answer, but how much of this is within our control? How much, because I know a lot of people, there is that kind of couple different schools of thought. So one is, it's just my genetics, for whatever condition, whether that be cancer, whether that be, diabetes, other, health conditions, sort of this, idea that, I'm genetically predetermined 100% going to have this outcome. And then I think there's another school of thought that's, the more of a newer school of thought, talking about epigenetics and how, our lifestyle choices, our diet, different traumas, or, how our lifestyle impacts our genetic expression. So what would you say, how much of cancer, is within our control? And I think that obviously is highly variable, but how should people think of that?
Yeah, that's a good question. I mean, I think that, you know, the way I look at it now is different probably than the way I looked at it before I was diagnosed. So now, and we kind of talked about my journey a lot, like I feel good again, and I've been feeling good for years now, and my life is, um, going more in the direction I hoped it would. So it's easier for me to say, but, you know, me now would say every day is a gift. Every choice you make for your health is the chance to either help it or hurt it, right? So whether that's, related to your diet or your lifestyle or stress or whatever. And, of course, we don't want it to be to the point where your healthy behaviors are stressing you out and causing more and you're so extreme that you can't live a normal life. Like there's something to be said for balance and not overdoing it, which, I think us in the health space, we can all kind of maybe sometimes veer towards that side of overdoing it and over trying to be perfect. But I have to tell myself what I tell my patients, which is if your healthy lifestyle is stressing you out, is it really that healthy for you? So, great question. Yeah. So, you have to find some kind of balance there. But I think we can control a lot. I don't think we can control the outcome, but I feel that it's, for me personally, like it's my responsibility to do the best I can with the gift I've been given of my life. And I feel like my life has been saved and spared for some reason, which I don't know what it is. But I feel like I have to do something with that gift and I have to make the choices that show my body and my mind that I love it, that I'm grateful for it, that I appreciate it, that I want it to be, working to its full potential. And so I believe in epigenetics. I don't believe our genes are our destiny. And I believe the way we think about that is going to affect our bodies and our minds and our health too. And I think that it's really important to also know that having that mindset of like you mentioned, oh, it's just in my family, it's in my genes, I have this, I have that. Like we kind of have self-fulfilling prophecies about the thoughts that we have. So then that's going to kind of lead you, you're going to prove yourself to be right if that's the way that you're thinking. So I guess to answer your question, I don't feel that, we can control the outcome. I think you can still do everything right and have something, happen. But I think the chances of that are less when you're doing what you can to prevent that. And I think that, when I look at my story too, my doctor told me when I was diagnosed, he was like, wow, with the size of your tumor, I'm surprised you're not advanced stage 4. I don't know how you're not, because that was kind of like something that didn't make sense. And later he, once he knew me more, he said, I think it was all your healthy behaviors, everything you were doing. I think that that's what really kind of, because the time frame for my symptoms and the size of my mass, he's like, it doesn't make sense. So I think even though I got sick and I had cancer, the things I was doing, thankfully, helped prevent me from getting to that point, which I don't know what would have happened if I was at that point. So I'm a firm believer that our choices do matter, but I don't think we're, ever promised anything. And I wish that we were, but you know, there's something about the universe and um, God and that, is not fully in our control with everything that happens, I think.
Yeah, I agree wholeheartedly with that. Um, and I think on that same note too, I just would love your thoughts on the concept of, your cancer diagnosis. You had mentioned there was roughly an 85% survival rate. What's the difference between the 85% that live and the 15% that don't? If you could even, um, do we know anything about that? How can, what can we do to, um, I think, some of the things that you mentioned already, the lifestyle things, taking good care of ourselves. I think there's multiple factors here, but um, yeah, it's always interesting. This idea of probability, of a prognosis, 60% survival or 80% survival. So, I'm always thinking, what are the differences in outcomes?
Yeah, I feel like that would be Tough to say for sure. I think that maybe some of those people, they end up, not responding well to therapy, um, for whatever reason. It could be, of course, like related to their lifestyle. I mean, I think it's also, of course, I don't have like a specific evidence of this, but I think that mindset matters. And we do know, there are studies that look at people who essentially lose the will to live, right? And what happens to patients, whether it's cancer or otherwise, they have a really serious chronic health condition and they essentially just say, I'm ready to die, I don't want to fight anymore. And those people end up, dying pretty quickly. Of course, there's variants of that, but essentially, um, I think that having that will to live is really important. I think our bodies like respond to that. That's also why we see when like married couples, that are older, a spouse passes and then the other one passes, somehow that happens more frequently. And it's like they're kind of keeping each other going somehow, right? Like, how can we explain that? Um, Not that that always happens, but you probably understand the point. So, yeah, I think there's something to be said for that. And I'm not really sure we can, definitively explain it. I think, another thing that I always tell my patients though too is numbers can be scary and statistics can be scary. And like that statistic, though it was like intended to be positive and make me feel great, scared me a lot. Because again, when you're looking at a young population, right? It's like, well, if 15% or 10%, because it kind of varies, 80, 90%, whatever, died, to me, that's still, you look at all the thousands or hundreds of thousands, I don't know, people who are diagnosed, it's still a lot of people who are dying and they shouldn't be dying, right? In my mind. So, um, compared to the average population who's not dying at that age. So, I always tell my patients too, like, we can't identify with the number, right? Like if someone tells you you have a 4% chance or a 1% chance versus a 90% chance, that's going to affect the way you feel. Like no question about that. But I think we have to try to like what I try to do, and I'm not perfect at this, but with myself is, okay, if there's a 1% chance, that means 1% is this. Why can't I be that 1%? Versus, oh no, it's only 1% that I'm gonna XYZ. Like, I think we have to empower ourselves that, maybe it's delusional thinking, not rational. But I do feel that mindset plays a big role in that and the mind body connection. I've probably said it several times already, but if and Travis tells me this too, my husband, that if I can do what I did, why can't someone else? And I tell my patients that too when they're going through something. I think we have to have that mindset and not so much identify with a number because that can really, you know, patients get, I mean, even I'm sure with you looking at like ApoE genes and things like that, looking at percentages and risks really get associated with that. And it can become an identity and it can become a self-fulfilling prophecy. And so I think we have to know the information, but really work on the mindset and the way that that information is going to affect our mind body and our decisions.
Yeah. Something that just came to mind that I think has been incredibly valuable to myself personally on a kind of related note is just the value in mentorship and seeing the possibility. And you had mentioned you providing mentorship for somebody else with your same diagnosis. And I think just that seeing that hope, oh, wow, they're, this person made it, and kind of, I think that's shouldn't be understated that seeing somebody else and proving to their own mind, oh, this is possible. Here is somebody that's walking, talking after, having the same diagnosis, and then here they are. Um,
Mhm.
so,
Yeah, and it's interesting because like a lot of my patients, they don't know my story and I share it selectively, bits and pieces, not to this extent. um, someone who's in active treatment or in recovery and it seems appropriate, right? Because I never want to make it about me and
right.
my, um, but there's times and a place where it seems appropriate and it is helpful. Um, and the reason why I sometimes will share that as well is because you can look at someone and you assume, wow, you're a doctor, you're healthy, you're young, you're XYZ, whatever. And you don't realize the things that, everyone we meet, like you said, everyone, has their own sources in the past of trauma or things they've been through. And I think that it can be really inspiring and encouraging to see someone like for me, in my journey, met people who had been through something similar. And that really helped me because I really felt like those were the only people who knew how I felt. And that was something that was really hard for me is like, as much as my family, my husband, my friends, like, were so amazing. It it's different when, to your point, someone's been through it and they know, even if it's like a different kind of cancer or a different, maybe it's a chronic disease or illness, but it was life-changing or disabling or something in some way, shape, or form. It really makes you feel known and seen and understood and not alone because I think it's very isolating for any age, but especially as a young person because when you're young, everyone's like starting their career, going to college, buying a house, having kids, and you don't think that, what most people associate as like a late in life issue, right? You don't think that it's going to happen at that point in time, and your peers can't really relate to it because it's not common. So I think finding those people, and I think as a doctor, when it is appropriate in those moments to share that, patients really it makes a difference because they feel like, wow, like, how I feel and what I'm going through. And to your point, like, if you can do it, I feel empowered that maybe I can do it too and get my life has a chance of getting back to where it was.
Yeah.
So I do feel there's value in mentoring and sharing and certain situations.
Yeah. Yeah. I think it proves to our own mind, if we're in that position that yeah, it is possible and here's proof, literally, somebody standing in front of me. What did cancer teach you that textbooks never could?
One thing is a phrase that my grandpa used to say. He would say, "Every day's a holiday and every meal's a feast." And I feel that way now, and I look back at myself and I'm like, I was happy, I liked life, like, I I wouldn't say to my old self, like, "Oh, I didn't appreciate things or I wasn't grateful," like, I was, but now just knowing, like, one of my friends made this comment to me the other day, we were, like, eating, and she's like, "You really seem like you just, like, appreciate and, like, enjoy your food," and I'm like, that time, everything tasted terrible. I never wanted to eat. I forced myself to eat healthy things, right? But I was so sick for so many months and I couldn't taste anything and so I'm like, I appreciate food now. Like I just have a different appreciation that I did before. Um and I feel like I try to make the most of every day more than I did before. Um and I don't mean this to sound pessimistic, but I also just feel like I learned, nothing's promised or guaranteed, and we never know how much time we're going to have.
Mm.
Um, Anything could happen tomorrow. And so I don't worry or dread or think bad things are going to happen tomorrow. But I see my relationship differently, my friendships differently. Like, how sometimes you're like, "Oh, should I tell this person, like, how much I love or appreciate them?" Like, you've probably seen me do this, Dan. Like, I feel like, take the time to tell the people around you how important they are to you, how much you value them, your relationships. Like, I didn't do that before, and I don't do that because I have a fear or something, but I just feel like I'm so grateful. Um, I also feel like it taught me that, you know, my faith is really strong and really important to me, and it was really challenged during that time. I went through some really difficult seasons with, like, what do I believe? Do I even believe in God? You know, it really shook things for me, but now I feel like my faith is so much stronger, and I feel like it taught me that my life does have a purpose, and that's something that my patients, whether they're believers in, Christianity or other religions or other things, I probably never would have said this to them before, but my patients that are going through really hard things, I really believe, it's not a bumper sticker phrase. Like, their life has purpose, it has meaning, it has value. There's something that they were uniquely created for to do in this world and to make a difference. And some of them, they're just like, wow. Like, and I probably never would have felt bold enough to tell someone that before. But I really believe that. And I believe that for myself now in a way I probably didn't before. Um, and I don't know what it is yet. I'm figuring it out, but I feel like it's just given me a different perspective and appreciation for life. And that's another thing that my very wise, wonderful oncologist said to me that I didn't agree with either, but he was right. He said to me when I was diagnosed, I mean, I cried in his office like pretty much every time I saw him. And he said to me, you know, you're going to look back and you're going to be grateful for this. You're not going to be happy that it happened. You're never going to be happy that it happened. You're never going to say, oh, I'm so glad and I wish that this, happened to someone because something good will come of it. But he's like, but you will see that you're grateful for it and that you have a new perspective that you never had before. Like the birds, you're going to hear them differently, and I remember thinking, this guy is nuts. I already like listening to the birds, what's he talking about? But he was right. And so I think, when you go through something, it does change your perspective. Yeah. So I don't know if that really answered.
It was a fantastic answer.
Yeah, it did. Certainly. Certainly. How do you define healing now compared to before?
That's a tough one. So we didn't talk about this too much, but I still have like some residual health issues from my disease and from my treatment. And so I think, to me now, healing there's kind of, I guess, different layers to it. Like initially, there was so much of me that was very unwell that I looked at healing as kind of like returning to baseline, normal functioning. And I think that in addition to that, it's a continuous journey that I'm, you know, trying to still work on, but having like chronic, health related issues. So for example, like I have lymphedema, I have neuropathy, I have scarring in my lung. It's changed my ability to exercise, some other aspects of my life. So I feel like I'm still working on like healing those, but it's like it's a process. And the cliche phrase you often hear is like healing isn't linear. And I think it's so true though, because it's something you're always working on. I don't think there's like a perfectly healed state, at least for me now. And I think what that also took for me was an understanding of letting go of the expectation of the person that I used to be and wanting to be that person exactly, because I'm not that person anymore. And I don't know that I ever can be exactly that state of physical health that I was. But it's doing the things I can to optimize my health now and heal the issues that I am still, managing. I think before that, I probably would have just thought it's like absence of any ailment. But I think now it's more of a, a continuum and a spectrum and more like a work in progress, I guess.
Yeah, I love that. Yeah, I think that's interesting. I was just thinking back on this and listening to a lecture by, I believe it was Mark Hyman, maybe, just talking about the different philosophies of, what is health. And, I think for most people, health means the absence of a diagnosis. And I think there's just so much more to it. And like you said, there's so many levels to health. So, yeah. Before we close, is there anything else that you feel particularly called to share to anybody, going through a similar journey, or any, family members, any closing thoughts?
Yeah, I guess the only other thing I would say is like, if you're going through something like that, or you have a family member or friend going through something in terms of a health diagnosis, like reach out for help. look into resources. There's so many resources, which we can like link a lot of those that helped me, that are out there. There's even resources, we can link to as well for like after, you're done with treatment. And so, don't think you have to go through it alone. Don't, feel like you can't ask for help. And if, you need to have other people ask for it for you, let them do it. And hopefully, it just gives people hope and encouragement that there's so much out there, for them, and that even if you're in the middle of it and you feel like you'll never be on the other side, there is, a hope to get there. It just might take longer than you want it to. But yeah, happy to provide any additional resources and insight that I can.
Amazing. And how can people learn more about you and what you're doing, what you're up to now?
Yeah, so I have an Instagram account. People can find me there. It's Dr. Maggie Boomgaarden. I also have an email that I think we can link to as well if people want to reach out to me via email. And then if someone's interested in seeing me as a patient in my private practice, they can contact me through the email. We can share my website too if anyone's interested in that. And the disclaimer, I guess we already talked about, is I typically, my expertise is not in treating cancer, but I do love working with prevention, survivorship, and, helping provide resources and things like that for sure.
Amazing. You're amazing.
You're amazing.
Thank you so much.
Thanks for having me. It's been great to be here. Thanks for listening.
So the views expressed in this podcast of myself and Dr. Boomgaarden are of our own accord, so they don't reflect her employer or Oasis Health and Medicine, the practice that I work at. So thanks so much for listening. If you would like to learn more, please check out the website at healingcancerproject.org and be sure to stay tuned for more episodes.